Good morning, everyone, and welcome to this meeting of the Mental Health Services Oversight and Accountability Commission. My name is Mara Madrigal-Weiss, and I am the chair of the commission. I want to thank you for attending today's meeting. The commission's strategic plan for 2020 through 2023 is committed to advancing the commission's vision of well-being for all Californians. Lester, can you please bring up the strategic goals slide? And I'm sorry, Lester, I wouldn't be able to tell if you have it up or not, or would I?
It should be up in just shortly.
Yep, I think I see it now. Perfect. Thank you kindly, Lester. All right. So we just wanted to remind everybody to ground us that this is what we are focusing here. So with that, I am going to ask Jeff if you could please take roll call.
Gladly. Commissioner Bontrager.
Present.
Commissioner Boyd. Commissioner Brown. Commissioner Bunch.
Present.
Commissioner Carnevale.
Here.
Commissioner Carrillo. Commissioner Chambers. Commissioner Chen.
Present.
Commissioner Cortese. Commissioner Danovich. Commissioner Gordon. Commissioner Mitchell. Commissioner Rolette.
Present.
Commissioner Tamplin.
Here.
Vice Chair Alvarez.
Here.
Chair Madrigal-Weiss.
Here.
You have a quorum.
Thank you, Jeff. We will now move on to agenda item number 2, announcements and updates. So at this time, I would like to make a few announcements. The January 2023 commission meeting recording is now available on our website. The next commission meeting will take place on March 23rd in San Diego. Prior to the commission meeting, there will be a site visit in Imperial County on Wednesday, March 22nd. I look forward to seeing my fellow commissioners participate in this site visit. Hopefully you will be able to join us there to see the incredible work being done in school mental health, as well as discussing identified needs. Imperial County in March is beautiful, and I hope as many of you will be able to attend. Plus the drive from San Diego down into Imperial is a gorgeous drive. So hopefully we will see you there. At this time, I want to turn it over to Jeff to introduce us to new staff. I know that one of the most common requests I receive from my fellow commissioners is a desire to know our staff and really understand more of the work they do. So last month, we were provided an org chart along with multiple projects, initiatives, and responsibilities of this commission. So we have so many more things going on, and the org chart was helpful. But having Jeff and Toby, as we move forward, introduce us to new staff and kind of highlight the work that they're doing to keep us, understanding is important. So with that, I am going to pass it over to Jeff to introduce the new staff and share some of the work that they'll be doing for us, with us.
Thank you, Madam Chair. It's my pleasure to introduce Kendra Zoller, who's here in the room. Stand up, Kendra, so everybody can see you. Kendra is joining the commission to lead our legislation. She will be the new legislative deputy here at the commission, and we're excited to have her. She has more than a decade of experience in the legislative arena, most recently at the Department of Insurance. And so we are thrilled to have her join our team. She'll be starting on March 6th. So if you have a chance, go over and say hello to Kendra.
Great. Thank you, Jeff. Welcome, Kendra. Well, we'll be, oh, I'm sorry. I didn't mean to cut you off.
Commissioner, 2 other quick announcements. We have one of our own, Reem, is stepping into a leadership position and taking on work in our grants area. I don't think she's here, but we want you to all know that we are excited to have Reem in her new role. And then also we hope to celebrate the departure of Ashley Mills and Brian Sala at our next meeting in Sacramento. And that's all the announcements I have for staff, Commissioner.
Perfect. We will be happy to receive Kendra, and glad that Reem has moved on to a leadership position, so a promotion. So congratulations to Reem. So thank you for that, Jeff. I also understand that a resource is being worked on by staff that will provide us more background on all commission staff. So we appreciate that and look forward to that resource coming out to us. So thank you. As you know, the commission works with a range of committees to support all of the work of the commission. And committees allow the commission to bring subject matter experts into our work, including representatives of diverse perspectives and communities. I have held off appointing committee chairs to allow staff to catch up with our significant workload. I recognize the value of our committees and the structures. Therefore, I am hoping to carve out time at our next meeting to discuss those structures and how we can ensure our committee work is aligned with our goals. As a lead up to the discussion, I have asked Norma to provide an overview of our committees and share thoughts from our staff on the goals we should consider. I'm hoping commissioners will make brief comments on the work of the committees to inform staff as they prepare for this discussion in March. So Norma, I would ask if you could just give us an overview of that work, of the committee work, and just provide that for us now, please.
Great, thank you, Chair. Yeah, over the years, the Commission has selected committees to focus on specific framework for the Commission. And as we move forward into our new year, we're looking at our strategic opportunities for 2023, and then also working towards our strategic goals in 2024 through 2027. And we would like to design our committee structure to support the goals that we've identified through our strategic planning efforts. And so we'll be working with commissioners and the public to decide what committees are needed, and as we design our committees for this new year. Over the last few years, our committees have been for the Client Family Leadership Committee, the Client Cultural Linguistic Committee, thank you, Kara, and evaluation committees. And we have very specific evaluation efforts and data work that we'll be working on over the next few years, as well as our FSP projects. And so we'll be looking at designing committees based on those, as well as other goals that were identified in January at the commission meeting. So hopefully that's helpful.
Thank you so much, Norma. So at this time, I am going to invite my fellow Commissioner Carnevale to make some comments about our upcoming strategic planning process, and invite commissioners to share thoughts on how we can make that process both effective and efficient. So Commissioner Carnevale, please.
Thank you, Chair Madrigal-Weiss. Just really brief comments because we're only getting started here, but we'll be seeing some more information today on the current strategic plan and progress that's been made. And the intention is to build on that into the future, consistent with the origins of the Mental Health Commission and trying to further our effectiveness for the people of California. We know we're doing a lot of good work, but there are also lots of shortcomings. And our attempt will be to identify those things that we should be doing in the future that will make sense for us to expand into, as well as evaluating areas that we've been in and taking a critical look to understand whether those activities should continue or expand or reduce, and working closely with all the commissioners on their priorities and trying to understand what everybody thinks collectively here we should be doing as a commission and building on our past success. So I think I'll just add that we are just at the moment now where we are organizing our thoughts about how the strategic planning process should be structured, and we'll begin to talk to some contractors who will help us in that process, which we've voted on a monetary allocation to support that process. And so we're just beginning to have those meetings now. Thank you very much.
Thank you, Commissioner Carnevale. Fellow commissioners, any questions or comments? Anything to add to what Commissioner Carnevale just shared with us? Okay, I'm really looking forward to this. There's so much was started in January, and again, I think that there's so much conversation, great conversation from commissioners. So I look forward to really organizing some of the thoughts that came out. You know, we talked about priorities, the commission schedule. How do we identify our priorities as a commission? The scorecard and dashboard ideas and the hot topics. So I'm excited, Commissioner Carnevale, and I thank you again for agreeing to take the lead on this work. So again, thank you. Can't say thank you enough for that. At this time, I want to invite any of my fellow commissioners to share any announcements you might have, news or updates, any research related to the work. You know, this is always top heavy, especially in the announcements that I share. So I just wanted to open up the floor and ask if there's anything you'd like to share. And this is kind of new, so don't feel pressure. Just wanted to open it up to you all. Okay, with that, I'm going to throw in a couple things then, because there's a couple pieces of research that came out in the last week. The Youth Risk Behavior Survey, the YRBS, came out, and I would really encourage us as a commission to look at that. I think, you know, when we're thinking about our school mental health work, we should be looking at the latest research that's coming out. Also, the CDC report that came out last week. You know, there's a lot of concern about suicide rates that had gone up in the last year as opposed to the last two years before that. A lot of concerns around, especially our young ladies, our teen girls. So considering that, how are we aligning? Are we asking those questions, I think, to Tom and his team, those that are providing technical assistance to all our MHSSA grants, just making sure that we're bringing out the great resources and being thought partners with all of our school projects around that. So I'm hoping that we continue to look at data and that we're informing the practices that are out there. So just wanted to make sure that, you know, as we're moving forward, we're always looking at the research and lifting up conversations around the data. I think it's important. So if you haven't seen those pieces of those research, if you haven't seen the research, I encourage you to. I'm sure that staff can pull it up for us as well. So just putting that out there. All right.
Chair Madrigal,
Yes.
sorry, now that I understand what you're asking for, I'll just also mention that
Please do. I know what you're going to say exactly. So please do.
It was, I think, last week that a paper was released by HHS that was organized by Breaking Barriers, which is an organization I happen to be involved with, a nonprofit that has created a series of recommendations on how to create a more integrated system of care for children and youth in California. And I think we all know that the system is very siloed and sometimes at cross purposes, and the people that pay the price, of course, are the children in the system when it doesn't work that very well. And so this paper, I think, is an important paper and taking a first step to really look at how to bring together the system in a more cooperative way. So I encourage people to go to the HHS website and look at that. Of course, the commission was also very involved in input on that paper and a wide range of constituencies. So just encourage you to read that.
Yes, sir. Thank you, Commissioner Carnevale. And I see that a lot of our partners that come to commission meetings contributed to that document. Excellent document. So thank you so much for sharing that. I could not agree more. I really appreciated the thoughts and recommendations put in that document. I see the alignment of so many different efforts in what was proposed. So exactly that. Thank you so much for sharing that, Commissioner Carnevale. And I see no other hands. Can't see in the room, but I'm sure staff would let me know. So appreciate that. Thank you for sharing. So at this time, I want to welcome everyone again to today's meeting. Our plan is to end around 1 o'clock. And with that, we will move forward. Commissioners, if you leave the teleconference meeting for any reason and decide to rejoin, please make sure you use the raise hand function so that Commission staff can make you a co-host again. If you have a comment to provide, please unmute your line and seek recognition when it is convenient. It is now time for agenda item number 3, general public comment. This time is reserved for comments on items that are not on the agenda. If anyone is interested in making public comment regarding the announcements or other items, please make those during this general public comment time. If you have any technical questions, please contact us at 916-500-0577. At this time, I will ask Amariani to go over the public comment procedures.
Thank you, Chair. All members of the public will have the opportunity to offer a comment as described in the agenda. If you would like to comment on an agenda item, please wait until that item starts. You may request to make public comment by clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. You will then be placed in a queue to comment on that agenda item. When it is your turn to comment, the moderator will unmute your line and announce your name or the last 3 digits of your telephone number. When you are unmuted, we are able to hear you. We will do our best to take comments in the order they are received. Please note, once the public comment period for the agenda item starts, we will close the public comment queue, so please make requests to comment now. The moderator will insert the word "last comment" next to the commenter's name or number to identify the last public comment. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. When we have reached the end of your time, our staff will let you know, but we will let you finish your thoughts. We don't mean to cut you off, but we do want to help everyone keep time. We truly appreciate your understanding with this process. Lastly, if there are any members of the public using translation technology, please notify the chair, and at least twice the amount of time will be given to you during the public comment period. A live meeting transcription or closed captioning is available for anyone participating in the meeting. If that option is not currently visible, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. Hey, Chair, I pass it back to you.
Thank you, Mariani. Would you please open the line for general public comment at this time? Let's
Yeah.
start- Oh, thank you. Let's start with comments from members in the public in the room, and then we can move to online attendees. Mariani, are there any public comments in the room?
Yes, we have 2. First, we have Stacy. You can go ahead.
Good morning, Chair and Commissioners. Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. Sorry, it's the first time I've been back at this meeting in person for a long time, and it's really great to be here. I'm very glad that you are going to be discussing the committees, because I think the committees of the OAC are really important and can serve to really aid the commission in its work. Again, I've said this before, but I will say it again. I really feel that you should have a legislative committee, particularly since you have a great new staff person. There are so many bills these days that pertain to the MHSA, and I think the commission should weigh in on those bills. But I think what's difficult is, in past years, bills have come before the commission, and we don't really know, who's picking them or why when there's so many other bills. I think a ledge committee can sort all that out and can discuss things that, don't need to be brought to the full commission. Or if there is a controversial bill, the initial conversations could take place in the committee. The other thing is, I'm hoping that there will be, excuse me, in your rules and procedures, you will add the parameters of what constitutes a committee and a subcommittee. This is not written down anywhere, and I have not been able to figure out who gets to designate what is a subcommittee and what is the committee, because you have both. And there seem to be very different rules for them. So I think it's very important that you make it known to the public, how this is done. I mean, I'm not saying subcommittees are not good or whatever, but please let us know how these decisions are made. Lastly, I hope that the CLCC, the Cultural and Linguistic Competence Committee, really gets to dive into what the purpose and what the role, because again, I think people that join that committee really, really want to help, but they seem, people are confused, I think, about what their role is and what the purpose of that committee. So thank you very much. And it's again, nice to be here.
Thank you, Stacy.
Next, we have Laurel.
Hello, I'm Laurel Ben Hamida from Muslim American Society Social Services Foundation in Sacramento and serving other parts of California as well, and REMCO. Of course, I would stand behind what Stacy has said, but I want to take a little bit different tack today. What I've noticed is that the reading load on people who work in community-based organizations has really gotten to be more than 24/7. And I have a suggestion. I floated this before when the Office of Health Equity was releasing the 5 population reports for the California Reducing Disparities Project. It would be wonderful if you could fund having your reports read and available to listen to while people drive, while people do self-care like exercise. For older people, that could also be a benefit. I'm getting older. You can see. Some of us went gray during the lockdown. So that's my comment today. And I look forward to a good meeting. It's good to be back in person.
Thank you, Laurel.
Okay, that was our last in-room comment. Now online, we have 3 comments. First, we have Jane, your line is open. You can go ahead.
Okay, thank you. Yes, I'm a peer in Santa Clara County with over 40 years of lived experience and also of being in locked facilities, both public and private. And I just wanted to ask if the commissioners are all aware, or I'm hoping the commissioners are all aware that there's a long time peer movement. Judy Chamberlain released a book in 1977 called On Our Own, and she and Daniel Fisher and other peers helped found the National Empowerment Center in Boston in 1992. And I mention this because we are a counterpoint to NAMI National and NAMI California. We are not, we've not ever been funded by pharmaceutical interests or Western medical model research interests. And I think this is really important for the children, especially to know and understand. All this focus on mental health is also ignoring the body piece. I mean, and our gut, which is as equally as powerful, like a second brain in the body. We have lots of interoceptors in our body. So I think I'm just concerned that children, that we have the correct education for prevention and early intervention that lets children and families know, and that we support organizations like CAMPRO and Cal Voices. And, we are trying to raise $75,000 for our annual conference in June. So I invite any of you to help donate to support CAMPRO for that. And, we don't have, we don't have pharmaceutical or research interest money. Thank you.
Thank you, Jane.
Next, we have Emily, your line's open.
Good morning, everyone. Can you hear me? All right. Oh, I'm assuming you can. My name is Emily Wu Trong. I am a former committee member of the Client and Family Leadership Committee. It's been several years since I have joined these meetings, and it's nice to be back. I am currently part of the NAPIAN, the National Asian American Pacific Islander Empowerment Network, which is actually a peer, an Asian API peer network, and based in Denver. And I'm also part of NAMI, the National Alliance on Mental Illness for Greater Los Angeles County. And I've been a speaker since 2010, public mental health advocate. In the time that I've been involved, I would say that there is a lack of support for the Asian immigrant communities. We just had a mass shooting in Monterey Park, and people are finally talking about mental health. I've been talking about mental health even before it became more trendy to talk about mental health before the pandemic. And the stigma works against me. But I do it for suicide prevention because I look outside the box. And I don't want school shootings to happen. I don't want shootings to happen anywhere. And there's just a lack of funding to support Asian immigrants in their language. And all the time I've been involved, in these last 10 years, I've been involved in mental health. I only know of one family support group that is provided in Mandarin and Cantonese for family caregivers who care for their loved ones with mental illness. And they only meet once a month. That's it. So, you know, Los Angeles has the densest population of the Asian community in the entire country. And so I have to refer people over to Elaine Pang's group at Mental Health Association for Chinese Communities. It's great that, there's so much research that is done, the CRDP was great. Rocco Chang was in charge of that project several years back. But so much money gets put into research, but where is the support? Where are the facilitators to support the community? Back in Nancy Ang, her sister.
Sorry, if you could just wrap up, sorry.
I'm just saying that there's a lack of support. And my expertise is in community mental health education. I have done mental health awareness programs in bilingual, in Mandarin and Cantonese. I am a peer. I can't find funding for me to sustain my efforts because I have burned out. And that's why I was gone for 6 years from mental health advocacy. And there, if peers are, if people want to support peers who are passionate about people who are struggling in silence, there needs to be support for these communities. And I can't sustain my efforts if there's no support. It's like asking victims of trauma, victims of human trafficking to share their stories of hope. But I'm sorry, I'm going over, but asking them to do it for free. Thank you for listening.
Thank you, Emily.
And then our last comment is from John. Your line's open.
Thank you, commissioners, and thank you, Emily, for sharing your story and voice. Hoping that there's more time to continue that conversation in the future. Just wanted to say I'm John Drebinger, Senior Advocate with CBHA. We wanted to provide comment in support of the commission voting to approve the 2 recommendations put forth at the PEI subcommittee meeting on January 17th. We believe alongside the broad coalition of supporters that these recommendations will improve equitable access to MHSA funded programming. And we hope that the commission considers approving those recommendations. Thank you so much for your time.
Thank you, John.
That was our last public comment.
Thank you, Mariani, and thank you everyone for your comments. At this time, the commission will now move to agenda item 4 and consider approval of the minutes from January 25th and 26th commission meetings. I would invite any commissioners to offer comments or questions regarding those minutes. So I can't see what's going on in the room. So any comments or questions in the room? I don't think I see any. No, I don't see any on.
No, there's none in the room, and I don't see any online either.
Perfect. So I would ask then that we have members of the public request to make a comment on agenda item number 4 by clicking the raise hand button or on your computer or app. If you're calling in by phone, push *9. Once the public comment period for this agenda item starts, we will close the public comment queue. So please make your request to comment now. And also we would ask that you please limit your comments to 3 minutes or less. So Mariani, are there any public comments? You please raise your hand now as the queue will be closing.
I don't see any, and there are none in the room either.
Okay. So then I would ask that a motion be made that the commission approve the January 25, 26 commission meeting minutes.
So moved.
Thank you, Vice Chair Alvarez. Do I have a second?
Second.
Is that Commissioner Carnevale? Thank you, Commissioner Carnevale. We have a motion and a second to approve the January meeting minutes. Are there any additional questions or comments from commissioners? Seeing none, I would ask Jeff if you could please call the roll.
Commissioner Bontrager. Commissioner Boyd. Commissioner Brown. Commissioner Bunch.
Approved.
Commissioner Carnevale.
Aye.
Commissioner Carrillo. Commissioner Chambers. Commissioner Chen.
Aye.
Commissioner Cortese. Commissioner Danovich. Commissioner Gordon. Commissioner Mitchell. Commissioner Rolette.
Aye.
Commissioner Tamplin. Vice Chair Alvarez.
Aye.
Chair Madrigal Weiss.
Aye.
Just going back to check. Commissioner Bontrager.
Abstain.
Motion passes.
Thank you, Jeff. We will now move on to agenda item number 5, the items calendared for consent. This includes the approval of 4 innovation projects from San Mateo County. Commission staff have sent the documents related to these projects to all commissioners at the time the February agenda was posted, and a copy of the staff analysis and letters of support have been provided in your packet. These projects had a significant amount of community engagement and support, not only at the local level, but also through the commission's process, which is outlined in the document in your packets. We received 43 letters of support for these projects. One of these projects addresses the mental health challenges of farm workers and has received some national attention. I would like to invite Charmel to share with us a little more information on this project as it can help us think about how we prioritize addressing disparities later in the agenda. Charmel, could you please provide some additional comments about the project involving farm workers?
Yes, thank you, Madam Chair. As you may have heard, a shooting had taken place on January 23rd at 2 farms in Half Moon Bay, located within San Mateo County. This shooting had resulted in the death of 7 farm workers who worked at 2 local mushroom farms. The advocacy group ALAS, A-L-A-S, Ayudando Latinos a Sonar, founded by Dr. Belinda Hernandez Arriaga, and the proposed contractor for the Mobile Behavioral Health for Farm Workers Innovation Project that's on consent today, immediately began to assist farm workers and their families involved in this mass shooting through their mobile van. Congresswoman Anna Eshoo, who represents Half Moon Bay, had invited Dr. Hernandez Arriaga to accompany her as a guest to the State of the Union address at the White House on February 7th. Only 2 weeks after the shooting. Following her attendance at the White House, Dr. Arriaga appeared on MSNBC on February 8th to discuss the needs of farm workers, calling on public officials to address the human rights and the mental health needs of this community. San Mateo is leading the way by proposing in this project that is found on the consent item today to address this underserved population through their innovation project. I just wanted to share that information as it relates to that project. Thank you.
Thank you so much, Charmel. Are there any questions or comments from fellow commissioners? All right.
I think Chair Madrigal-Weiss, I think I'll just comment that it's an incredible example of centering community leadership and really utilizing the strength and power of our community members to help heal. And Dr. Arriaga is entering that in the work that she's doing with this project. And I'm excited that the commission is recognizing that and investing in it.
Absolutely. Thank you, Vice Chair Alvarez. Any other comments, questions? Okay, we will move on. Just a quick reminder that any commissioner can ask to have an item on consent calendar removed and considered as a regularly scheduled agenda item. So at this time, I would like to invite, at this time, I would like to invite members of the public to make public comment on agenda item 5 by clicking the raise hand button on your computer or app, or if calling in, pushing *9. Once the public comment period for this agenda item starts, we will close the public comment queue. So please make your request to comment now. Also, please limit your comments to 3 minutes or less. Mariani, are there any public comment requests in room?
Yes, we have one, Stacy.
Thank you. We'll go ahead and start with the public comment request in room, and then we will go to the virtual comments if there are any. So Stacy, please.
Good morning again, Stacy Hiramoto, REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I just want to urge the commission to approve the consent calendar. People from San Mateo County called REMCO and are involved with the CRDP. And I think the music therapy program, if you saw how many of letters of support they received, and it just gives hope. You heard Emily give an impassioned speech. I think it is no secret that there is a lot of stigma, unfortunately, yet in the Asian community around mental health issues. We want to get rid of that. And again, this music therapy program is a great first step, I think. So thank you.
Thank you, Stacy.
And that was our last comment, both in the room and virtually.
Thank you. Now that the public comment has closed, I would entertain a motion that the commission approve funding for San Mateo County innovation plans. Do we have a motion from commissioners?
So approved or so moved. That's what I meant.
I'll second.
Thank you. Is that I'm sorry, I could not tell. Was that Commissioners Templin and Bunch?
Yes.
Perfect. Thank you. I see no other comments regarding this item. I would ask Jeff if you would please take the roll.
Commissioner Bontrager,
Aye.
Commissioner Boyd, Commissioner Brown, Commissioner Bunch,
Aye.
Commissioner Carnavale,
Aye.
Commissioner Carrillo, Commissioner Chambers, Commissioner Chen,
Aye.
Commissioner Cortese, Commissioner Danovich, Commissioner Gordon, Commissioner Mitchell, Commissioner Rolette,
Aye.
Commissioner Tamplin,
Aye.
Vice Chair Alvarez,
Aye.
Chair Madrigal Weiss,
Aye.
motion passes.
Excellent. Congratulations to San Mateo County. All right, we are moving right along. I don't think ever in the history of the commission have we reached agenda item number 6 by 9:48 a.m. Please, let's record that. Okay, here we go. Next, we move to agenda item 6, mental health in the workplace. The commission will hear a presentation on the Workplace Mental Health Project and consider adopting the Mental Health in the Workplace report and standards. Guided by Senate Bill 1113, the commission formed a subcommittee to explore opportunities to advance statewide workplace mental health strategies. Commissioner Bunch chairs the subcommittee, and I sit as the vice chair on this subcommittee. This project has involved engagement with a wide variety of employees, and subject matter experts from around the world on workplace mental health. The subcommittee and staff have held virtual meetings, employer roundtables, and interviews to gain insights into the needs and opportunities to support mental health at work. It is primarily a prevention and early intervention strategy and offers exciting pathways to provide improved access to mental health care. A draft report, including the standards and 3 sets of findings and recommendations, was made available for public review beginning on December 19, 2022. On January 12, 2023, the subcommittee recommended the report for adoption. Today, we will briefly review the report, which includes policy recommendations and a set of standards for workplace mental health. We will also have the opportunity to talk briefly about opportunities for implementation and next steps. Anna Nafee, the commission's consulting psychologist, was the staff lead on this project. At the same time, she stepped up to provide mental health first aid trainings to commission staff and several state agencies, modeling an identified best practice by promoting mental health literacy. She was building the plane as she flew, so to speak. Anna did an incredible job leading this work, ensuring voices from various sectors were included, as well as perspective from various workplace roles informed the report, from frontline workers to CEOs, middle managers, and others along the spectrum. And I want to thank you for your dedication. You did an incredible job leading the work. I also want to recognize Commissioner Bunch for her leadership and the many additional hours she spent committed to moving the work forward. Commissioner Bunch brought the essential perspective of her work from Los Angeles County, perspective of her work for Los Angeles County Mental Health, her work with schools and public safety partners, her personal professional background as a psychologist and mom, as well as her role as an essential worker, stepping up during the public health pandemic and mental health crisis. Her vast experience as a staff member, a supervisor, and mental health advocate served to inform this work and propel it forward. Thank you, Commissioner Bunch. I want to be clear, this is groundbreaking work for our state. Similar work is being led by the U.S. Surgeon General and the World Health Organization. This project has the potential to fundamentally reshape how we think about and respond to mental health needs. And it is a tremendous opportunity to address stigma and improve access. At this time, I would like to invite Commissioner Bunch to kick us off and then have Anna walk us through the project, the standards, and the related recommendations. So Commissioner Bunch, if you would like to just make any remarks with us, then we will have Anna share the report with us.
Sure. Thank you. I just want to reiterate and thank Dr. Anna Nafee because she did an amazing job on this and has put in so much time and effort, and it's been really a pleasure working with her in this project, because just from the very beginning. And we've been doing this for a while, but she's stepped up and done an amazing job. I'm looking forward to seeing the standards being implemented in county behavioral health department and in education systems. My hope is that departments are open and accepting of the recommendations in a way that really does increase mental health of people in the workplace. I was thinking about this project a lot recently because I keep seeing memes that say, I live at work and visit home. And that is so true. Even with teleworking, I feel like such a big part of our lives is committed to working. So I'm really hoping that something like this is a way to increase positive workplace environment for everyone. I'm excited to support crisis workers and reduce secondary trauma and burnout, and really hope the project can increase mental health benefits for families. And just overall, I'm excited to see what happens with this after all the work that Bill put into it. Thank you.
Thank you, Commissioner Bench. I know that when we started this work, there was confusion as to why the commission was focusing on the private sector. The COVID pandemic and its impact on population mental health really has shifted awareness on additional opportunities to ensure appropriate and adequate access to prevention, early intervention, and comprehensive services. So with that, I invite Dr. Nafee to please walk us through this report. I'm sorry, through this report work. Please walk us through it.
Thank you. So yes, I'm Anna Nafee. I'm the consulting psychologist for the commission. My pronouns are she and hers, and I'll look for my slides to come up there to start. Okay, and I have the clicker. Okay, so just to start, I wanted to frame this with the commission's mission statement, and that this workplace mental health project was designed as a strategic priority in the current strategic plan for the commission. And it's really meant to catalyze transformational change. It's kind of a unique project. It's a little bit outside the box, but it's really become, I think, so important and central to the commission's work and the conversation around mental health. As the chair mentioned, the project was started by Senate Bill 1113 and was really designed to address stigma as a kind of a central strategy, increase awareness, and create avenues to treatment. And as the chair also mentioned, we're joining some other large efforts that are underway now with the Surgeon General and the World Health Organization. But part of this work was created after looking around the world at how we could support workplace mental health, and looking at the Mental Health Commission in Canada and some of the other standards that came out of the UK and even Australia. And so we took information from all of that in modeling the report and the recommendations. So why focus on mental health at work? So we know that there's a huge need, and we know that we adults spend a lot of our time at work. And when work is healthy and promotes mental wellness, it can really provide a sense of purpose and accomplishment and a lot of really positive things for us. But when the work is stressful and or we have things going on in our lives, it can really turn into a place that creates a lot more need. And so we saw this increase really dramatically with the pandemic. And this project ran during the pandemic and was really influenced by that as well. We know that about half of Californians have employer-sponsored healthcare plans. So we're talking about a really, half of us, that's adults and dependent children. And yet there's these plans, which also support mental health care, don't provide the array of coverage of mental health benefits that Californians need. We heard a lot from people about difficulty with wait lists and high copays and network inadequacy, lack of parity with health. We heard about difficulty with care coordination and navigating the system. And so really, if we can make this work and increase the quality of our private healthcare industry, we can really bolster mental health for about half of Californians. So we see this as a key prevention and early intervention opportunity where the workplace can provide wellness and also access to appropriate, comprehensive, culturally competent care. So we did a lot of work with this project. We did a lot of engagement with a lot of different communities that are outside the normal commission's range of partners that we typically engage with. We started by commissioning a researcher to provide a background brief, looking at some of the other standards and the components of the other standards around the world and comparing those so that we had a baseline framework for what kinds of things need to be in a standard. And also to understand, what has worked and what has not worked, and all of that informed this report. We did a lot of interviews with different employers and employees and mental health advocates and researchers from around the world, really, to hear about the needs and some of the best practices that are out there. And you can see the list of employers and people that we talked to in Appendix D of the report. In May of 2020, we held a virtual public meeting, which, if you can think of in timeline, that was right in the early part of the pandemic. And we had over 300 attendees on that virtual public meeting, which I think really spoke to the urgency and the importance of the issue at that time. From that, we did a landscape analysis. And then we held an employer roundtable, drilling down on engaging some of those employers that were really doing outstanding work in this space to understand what are their best practices. We held a public hearing last year and then released the report in December of last year. And as the chair said, the subcommittee approved the report in September or January of this year. So putting all of that together, we came up with 3 findings and recommendations. The first being that the workplace is a strategic setting to promote mental health and well-being of working age adults and their dependents through stigma reduction, improved awareness, and better access to care. And the recommendation here is that the state, in a partnership with the private sector, so really thinking about this endeavor as a public-private partnership, launch a center of excellence for workplace mental health. What we heard over and over from employers was that, there a lot of employers, the person in charge of mental health is their human resources director, right? And we heard that there's just a huge lack of information around mental health literacy, around what are some of the best practices out there, around what to do to support employees. And that all of those things led us to think about creating a center of excellence. We did recommend that the Center of Excellence be housed in a university setting or in partnership with the university, because there's also a lot of need for research in this area. The next finding is that California can improve access to mental health care for working adults by leveraging employer-sponsored mental health coverage to promote access to high-quality, outcome-driven care. And we recommend that the state work with large healthcare purchasers, beginning with CalPERS, who in fact is the largest, the state in itself is the largest employer in California. And so by starting with CalPERS, we have the opportunity to reach the largest employer in California and their benefits packages. And the state leveraged the purchasing power of the public sector employers toward improve access to care, quality of care, and comprehensive coverage. So, you know, some of the projects that and the programs that the commission works on in the public sector, such as early psychosis intervention or ALCOVE, are not available to people who have private insurance coverage. And so there are a lot of examples of that. And so there's an opportunity for intersection of some of our work here to begin to think about how can we expand coverage and the continuum of coverage for large employers. And then the third recommendation or finding is that there's just not a lot of data and research about this. A lot of employers that we heard from reported that they just didn't have information about what are the benchmarks they should strive for, what even should they be measuring. And then as a state, we just don't have a lot of data around workplace mental health outcomes or even network adequacy and that sort of thing. And so the recommendation is that the Center of Excellence identify and establish a research agenda to identify indicators and measure and monitor progress on mental health practices and policy. So now we get to the standards. So the standards, there are 5 standards, and they're really built on a public health model. And for those of you in the education system, this triangle probably looks a little bit familiar. And so but the first standard is foundational, and sorry, let me just explain this picture a little bit. So this is the framework for the standards. This is how all of the standards relate together. And so the first standard is around leadership, and it really goes across all organizations to support all employees. And I'll explain a little bit more about that in a minute. The culture and climate, creating a positive culture and climate is something that all employers can do to support all employee mental health. And that's why it's the largest part of the triangle. As we move up the triangle, providing access to services for those individuals who need additional services and supports or connection to resources is for fewer individuals, but the recommendation is that all employers have some sort of information about that. And then the top of it is just for the few employees who do need access to higher level mental health care, and also to plan for crises at the organization level, which I'll explain. And then across all of that is a continuous quality improvement process. So the organizational leadership and commitment was something that we heard over and over again, how if an organization wants to start changing their culture and being more supportive of mental health at work, that it really has to come from top leadership. Both because top leadership can model, be role models, and even reduce stigma by sharing their own mental health stories or their families, but they also have access to the purse strings. They have the resources. They can allocate budgets to this and time and that sort of thing. So really, that was something that we heard over and over again, how important the leaders are. In terms of the positive climate and culture, I wanted to share a quote from an individual that we spoke to at Beach Cities Health District, who Beach Cities Health District actually won the American Psychological Association's Healthiest Workplace Award in 2019. And this employee said, "Working here has made me a healthier person." So thinking about, just because this person worked at that place, they got information and access and resources and tools to make them even healthier than when they started. That's sort of the ideal. But this is also where we see the intersection of diversity, equity, and inclusion really being central. A lot of what we heard was the separation of DEI practices from workplace wellness. And so there is opportunity to merge those and thinking about whole person wellness and how culture, race, ethnicity, and all kinds of diversity intersect with a person's mental wellness, and how the organization can support all of those things. This is also about fostering creativity, participation in the workplace, being flexible. And a lot of this is about manager supervisor support. And the managers and supervisors are really key in supporting the climate and culture. Access to services and supports is around having mental health benefits, whether that be EAP benefits, plus mental health benefits in your health benefit package, or for even smaller organizations. We heard about best practices where there's a local restaurant here who identified the need to provide just a list of mental health providers, Medi-Cal providers in the community that they could refer their employees to. So this can be a range. And this is where really we can bolster up to parity with health benefits. Crisis preparation, response, and recovery. So this is at two levels, at the organization level and at the individual level. At the organization level, really organizations that have thought a lot about mental health in the workplace have done a lot of preparation to respond to potential crises. And have done really good work when there is a crisis to support their employees. So crises such as suicide or suicide attempt in the workplace, violent situation, even community-wide crises. And then at the individual level, this is really the organization's ability to support employees who may need to leave for time off to support their mental health in their return to work, being compassionate and flexible and supportive in their relationship with that employee. And then finally, the measurement, evaluation, continuous quality improvement is something that we heard about over and over again, and also from organizations, but we also heard about this from other commissions and other national standards for workplace mental health around the world. So I wanted to just mention a couple key opportunities ahead. Should the commission adopt this report today, these are some of the things that we may start embarking on. So establishing the Center of Excellence would be one of our first priorities, and finding a way to do that. There are another opportunity is to encourage other state departments to lead in this effort. So for instance, encouraging CalHR to adopt the standards would be a really big move. And then also exploring financial incentives to implement the standards in local public agencies. So thinking about the commission's financial incentive tools and other financial resources and incentives that are out there, and finding ways to leverage those to begin to support local behavioral health or health entities or education systems or other entities that are interested. And then with that, I will move to proposed motion. So that's, let me go back to just this. Thank you. And I think that's all for now. If there are any questions, I'd be happy to answer them.
Thank you so much, Anna. Brilliant report and summary. I remember the first event we went to as we were trying to learn more about this effort, the Kennedy Forum, I believe that's what it was called. And we were very starry-eyed listening to the amazing work. And I think just imagining the possibilities. So we've come a long way from that first forum. And again, can't thank you enough. So at this time, I would like to invite commissioners to offer comments or ask any questions.
Chair Madrigal Weiss, I have a comment and a question.
Please, sir.
Thank you. As a business representative on the commission, I am highly supportive and really interested in this whole area. My work in neuroscience tells me that purpose is fundamental to our brain health, and work is one of the essential elements that does that. And as we see it gets carried away, it has negative implications. And so this is a big issue. There is this, this gap in health standards between general health care like cancer care and treatment versus brain-based health. And this is a good example where the standards are not working. The thing that I know about, one of the things I know about this is that I work at UCSF with a researcher who does a lot of work in entrepreneurship and mental health, and has found there's a huge connection there. And the reason that's important is because small business is what generates most of the new jobs in California. So when we think about the problem, I think more about small business than big corporations. And that particular journey is both suspect to lots of failure, and it turns out the research shows it's actually very predictable. So there's a lot there to unpack. But it leads to my question, which is we think of this public and private sector, it gets presented like they're very separated, but I think there's a lot of flow that goes back and forth. And what we know is people who are in the private sector and have issues end up in the public sector. I'm wondering what data do we have to support this flow between them that supports this idea that we can't think of this as such a big wall?
It's a good question, and I don't have the data in front of me, but I do know that I understand the issue, and I know that it's something that happens, and particularly I think what you're talking about is when the private insurance benefits fail, that people flow into the public health system. But I don't know what percentage or proportion that is.
I would encourage us to try to figure that out, and because we, create such an artificial line, but I don't think that's line is really relevant to what we're talking about here.
No, and you're right I think to think about that as a sort of a baseline benchmark now, that we can then begin to watch over time as the standards are implemented, because the hope is that ultimately those individuals would be able to stay in the private sector and be supported with all of their needs by their private insurance. So
exactly.
Yeah.
Thank you.
Yeah.
I just want to.
If I could, I wanted to just respond to that. I would say from a very clinical, real world perspective, I see it on the regular, like that there is a difference and that there is a line. I don't know how frequently we've had clients with really severe symptoms who had private insurance and were not able to get the care that they needed. We've had families who had to cancel their private insurance so that their children could go to public mental health, because the intensity of services is very significant. There's a real difference. But I agree, we should definitely look at it and keep watching it.
I wanted to jump in also and just support that effort, because it is, I think, information we need to have, and it is happening. And so I really appreciate this work, focusing on that. Commissioner Bunch and Dr. Nathy and the whole team that worked on this. The one piece I also wanted to add, and I heard you talk about this, Anna, was the support and trainings for managers and supervisors. I think it was recently I read an article where it said, supervisors are the individuals that have the biggest impact on an individual's mental health over everything else, because we're here trying to work and get things done, and also then, make ends meet. And when that relationship isn't a match, I'm passionate about this work, right? But if that person I report to is making my life much more miserable,
it's going to be hard to come back the next day. I mean, we do it, but it's, emotionally draining. So I think that, in mental health, sometimes that may look like someone, as a therapist moves up into a supervisor role and doesn't know the difference between being a supervisor and being a therapist are two different things, especially when you're helping someone be successful in their work, not necessarily providing them therapy. So that's, I think, an area that I feel like we lack the access to additional trainings and mentors to help people navigate those kind of complex relationship team things, because small or big, in the end, it's that team that has the biggest impact. So I'm excited about this work again, and innovative, groundbreaking work that we're embarking on. And then I just want to add the piece about, and you talked about stigma and discrimination. Sometimes telling your story, as Emily highlighted, has other impacts on us. So in the workplace, you just got to navigate what you're willing to put out there, and hopefully it lands in a way that is equals to more support. But to that stigma and discrimination piece, I feel like it's been a long time since we've looked at for our state addressing the mental health stigma and discrimination across our state. So I'm hoping this can, contribute to that effort to elevate the understanding of mental health recovery, and that there are resources to help people get on that track if they're in need of it. So thank you.
Thank you. And I think I could see both of those supports coming from the Center of Excellence, providing training and resources to support managers and supervisors, and also stigma reduction strategies and campaigns that can be disseminated out to employers. And to your point too, Commissioner Carnevale, that's one of the things that that small businesses can do, just stigma reduction, and that would have a huge impact. Even if they don't provide healthcare benefits for their employees or don't have access to some of the other fancier benefits, just stigma reduction information and culture and climate would be hugely impactful.
Are there any other questions or comments?
Commissioner Rolette,
Please.
first of all, I certainly want to endorse the subject matter. It is very important. Having had the unique privilege of working in and now leading a community-based organization and its workforce, and appreciating the implications associated with having individuals who may encounter some acute distress, and having the public sector safety net insurance provide a more comprehensive array of support than the private sector is a conversation that I certainly would love to participate, because from the perspective of my own, I think that advances a type of stigma that should be talked about. Secondly, I completely agree with the notion that in the workforce, my own experience is that we are really hoping to help train and support as individuals move into positions of leadership, as my colleague on the commission just said, and their ability to advance a degree of emotional intelligence and ensure psychological safety in the workplace. That is an essential part of the training if you're going to be a leader / manager. And there are not a plethora of places where you can get that kind of training to become a leader manager in an organization, and especially a community-based organization. So as that may be inculcated at some point into the work that may come out of this report, I completely endorse it.
Thank you, Commissioner Rolette. I appreciate those comments and cannot agree more with everything that has been said by my fellow commissioners. I know, being a part of this subcommittee along the way, this is not something that we generally, I'm sorry, see in schools. And during the pandemic, myself and my team created a workshop for managers specifically on how to provide mental health check-ins for staff. And it was something that had not really been provided in credentialing programs. And so what does that look like? And how do we have conversations? And that really helped get to stigma. It was something that we were all having to deal with. And so just conversation starters, and how do we do these check-ins, and how often do we do the check-ins? And so that started to normalize conversations. And now we have been intentional with human resources and providing mental health first aid training to human resources so that we can start to have these kinds of conversations. So this can really begin that flip in where our industries have been before. And I think, when I made the earlier comments about this can take us to levels of breaking down that stigma is huge. So I appreciate all the comments that have been made. I don't see any other raised hands by fellow commissioners unless I'm missing something, and see nothing else in the room. Commissioner Tamplin, I too read that report. There was a huge study done across, I think it was 10 different nations that have participated. And employees did report that the person who most affects your mental health are your supervisors or managers, superseded your significant other, and even your medical doctor. So I thought that was really interesting. Now is the time for us to address workplace mental health for sure. So seeing no other comments or questions from my fellow commissioners, I would ask that we move to public comment on agenda item 6. We are going to ask that you please raise your hand on the button on your computer or the app, or if calling in, please push *9. Once the public comment queue, we're going to open the public comment, so please make your request to comment now. I'm going to ask Amariani if there's any public comments. We would want to start with those in the room, and then we will move on to those in the virtual world. I would ask that you please limit your comments to 3 minutes or less. And Amariani, please open up that the queue, and let's go ahead and begin.
Okay, we have one in person, Laurel.
Well, I have to confess, I did not read the report. Now, if I'd been able to listen to it, I would have, for sure. But I'd just like to make some comments anyway, with that apology that I didn't read it. Of course, this is so important. We spend time at home. When we're at certain points in our life, we spend time at schools, and we spend time at work, so much time. So this is a really important report to disseminate to the people who are supervisors and small business owners and so on, and they have even less time than I do. Yeah, so having it available for them to listen to would be very good. Those people supervise people who are college educated or not. White collar, blue collar, no collar. And I do wonder at the end, and I just think maybe it was a strategic decision, but I did wonder that you mentioned opportunities, but were all with government or public sector going forward. And I would think that the private sector, the big businesses around here like Intel, which you can talk to anybody who knows what goes on in Intel, and all the doctors in the area and so on, are those, it's not just mental health, physical health, physical health, state employees who are in private sector jobs. I don't want to forget them either, but I'm focusing on private right now. And then the small business owner, who is the supervisor, the manager, the person who's got to pay the tradesmen on Friday and has to let them go for a couple of days because the supply chain is disrupted. So all of these are really important. Thank you for your work.
Thank you, Laurel.
That was the last in-room comment. We have 4 virtually. The first one, we have Emily. You can go ahead.
Thank you for facilitating this discussion. I really recommend anyone talking to read this book, The Myth of Normal, by Dr. Gabor Mate. He's a really good therapist or person who really talks about trauma. And I mean, ever since I became a mental health advocate, learning about the recovery model, I love the recovery model because right now we still live in the medical model. And the medical model says that all the PhDs, the PsyDs, the MDs, the masters, the MSWs, like they're all the experts. The peers, they're not experts. They're not. There's a disrespect, like for the peers, and they're not considered as experts. I've been disinvited to be a speaker before because they're like, oh, Emily, I didn't realize you weren't a mental health professional, so we can't have you as a speaker. But I've been invited by Dr. Ellen Sachs at USC to talk about this topic. What it's like to be a peer in the workplace, and what kind of stigma and discrimination do we face. There's a lot of unhealthy self-esteem out there in any industry that you work in, where people think that they're better than you because they have these higher degrees, and or because I have these titles, I'm better than you. Like this attitude of elitism. And that's why peers, when they disclose and they say, I have emotional struggles, they get discriminated because then they look down on, oh, you have problems. Yeah, well, I have courage to talk about them. But John Lennon said, being honest you may not get many friends, but you at least get the right ones. And I shared this quote at Dr. Ellen Sachs' talk. I also have admired Martin Luther King Jr. ever since I was a junior high. He said, I dream of the day when my 4 children will not be judged by the color of their skin, but by the content of their character. Content. Character. We forget that character matters. And if people in the workplace don't care for honesty, well, then I don't want to work for them. And it just goes to show that many people have different value systems. I don't care about how much money you earn, what degrees, titles you have. I care about whether you are a kind person. Is your heart big? Do you truly help the people? And are you supporting your staff that may be suffering burnout?
Time is up.
So unhealthy self-esteem, it's all over the place, and we need to address that. Thank you.
Thank you, Emily.
Okay, next we have Tara. Your line is open.
Hi, Chair and Commissioners. Really appreciate the time today. Tara Gamboa Eastman with the Steinberg Institute. We were one of the original co-authors of the bill that led to this report, and we're just so thrilled to see it finally coming together, and really want to thank the subcommittee and the staff for their tremendous work. We know you've had a lot of competing demands in the last few years, and are really thrilled to see all the wonderful work that went into this, and really want to applaud in particular the standards. We think they're wonderful and hope that more work will continue to see them implemented and adopted in private workplaces and in our government offices as well. The one point that we wanted to highlight, in addition to our comments in a letter that we shared, was we do have some concerns over the establishment of a center of excellence. While we totally understand the work that needs to be done, we're worried that it might be duplicative of existing efforts and centers of excellence and might encourage the commission to explore building off of existing centers of excellence and building that into their workload rather than building a new center of excellence. But again, really want to thank you for the wonderful work and are really excited to see the next steps from here. Thank you so much.
Thank you, Tara.
Next, we have Michelle. Your line is open.
Good morning, Chair and members. And this is Michelle Cabrera with the County Behavioral Health Directors Association. Want to thank the Commission for lifting up these important topics and themes, and particularly the comments from Commissioner Carnevale regarding the flow back and forth between individuals who are unserved or underserved and the public safety net system. These are issues that we've only begun to scratch the surface of in terms of how stigma play out. I think Commissioner Rowlett also spoke to this really well, and I just want to highlight for an example for you. We are in the process of standing up a mobile crisis benefit for the 1/3 of Californians who have Medi-Cal coverage and attempting to meet all of the requirements that come along with that. While AB 988 last year had some language which would expand potentially coverage for mobile crisis services for people with private insurance, it applies a different insurance standard. So people with a crisis or emergency in the field will have to establish or demonstrate to those insurers that they met medical necessity. Whereas if you have a physical health emergency and EMS is called out, they use a prudent layperson standard, meaning if you thought you needed an ambulance in that moment and 911 was called, your insurance has to cover that. These sorts of gaps in coverage lead to the safety net being under-resourced to deliver what the community at writ large really wants to see, along with failure to cover things like early psychosis in private insurance plans. And I think it's fair to say that there are individuals in the public system who have made the painful decision, as Commissioner Bunch mentioned, to drop their private insurance so that they can avail themselves of the much more intensive and rich array of services in the public safety net. But the time for the public safety net to try to hold up their part and then some, is over. We really do need to make progress on coverage, but also understand that the intensity and the duration of behavioral health services is different oftentimes than what is required for a physical health need, right? You may see your primary care physician for 15 minutes once or twice a year. That's different from if you have even a moderate mental health need, seeing your provider once a week or once a month for an hour. And so there are the intersection of insurance and coverage, cost sharing, et cetera. All of these things need much more advancement, not just in California, but throughout the country. And we really appreciate the Commission's efforts to lift up these themes and topics and look forward to continued work moving forward beyond employer culture. Thank you.
Thank you, Michelle.
All right, and the last comment is Steve, and your line is open.
Thank you very much. Hi, my name's Steve McNally. I'm from Orange County. I am on one of the state's 59 behavioral health advisory boards with the Welfare and Institution Code 5604.2 statutory duties, which covers a lot of territory. But my comments are my own today. And having been watching Staglin and One Mind at Work over the years, it's amazing how much it's grown. And I always wondered when Brian Monahan, at Bank of America, is a fairly high level executive, whether my Bank of America person at the Orange County Business Orange County Business Council has any idea if what Brian Monahan's doing with mental health and how the HR at Bank of America is so involved with this project. So I'm gonna ask that as you go through this, build in a role for the local communities because it'll give people ways to break the silos and the filters that exist. And just looking at the list while I was waiting, a lot more companies are there from my community. And also that 45% of California is in 4 counties and they represent the LA TV and radio market. So if you were to think about LA, San Francisco, and Sacramento and taking up the California endowments offer of free space, we do have opportunities to do town halls and to put the same people in the room because sometimes the state, it seems like it's the same presentation given to siloed audiences. And back in 2012, I think the California Department of Education, they had this big clearinghouse of all sorts of materials that people could just select from. And having attended many meetings, what I find is there's tons of stuff, it's just not shared. And there really needs to just be a clearinghouse and an ordering process for people or someone to collect it and maybe let people get all the free stuff that is available. And then if there are things that you might want to white label, and whether that might be the pearls for older adults or just different products that could be white labeled within the marketplace, because even now with the peers, calling someone a peer or a mental health worker or something, if they get out of the mental health space and those tools that they have will be transferable, maybe that title isn't so transferable. So anyway, I'm really glad to see us doing this. I wish we could figure out how to get the health insurance plans on part of this because they seem to have been able to manipulate the marketplace. And I am one of those families that have gone to the public insurance because of serious mental illness. And I'm very surprised at how little the private marketplace really is supportive of it. Thank you very much for letting me share. Hope you guys have a great day.
Thank you, Steve.
And then we have one last comment, call-in user 4. Oh, 1 second. Okay, call-in user 4, if you can go ahead, your line's unmuted.
Hi, this is Mark Carmatz. I want to support the comments that Emily Wu Chong really made. They were very, very strong and very important to her here. I have a question though, and the question is, are they using peers as supporters with this program that was just presented? And if as supporters and who are working in these companies, that's the question. And if not, why not? The reason why I'm saying that is because peers can support because they have that lived experience. And it's very important that that take place. And that is with certified peer support specialists, the PEARLS program, and Fidelity Assessment Common Ingredients Tool, and others, and also intentional peer support. That needs to take place.
Thank you, Mark. At this time, I think when we look at the standards and the recommendations, I think depending on how it's adopted within each industry, it's not that scripted to that level. However, I think that given everything that this commission supports, the use of the peer model would be something that we would consider a best practice without a doubt. So
Thank you.
absolutely. So thank you for your comments. We appreciate that. And Emily, agree with you. I'm 1/3 through that book. Also agree with the principles of Gabor Mate. So thank you so much, everybody, for your comments, for your support on this. Again, Commissioner Bunch, Dr. Nafee, excellent job. It was an honor to also be part of that subcommittee. We've come a long way. So with that, I don't see any other comments. Is that correct, Amariani?
Yes, that's correct.
All right. And I don't see comments or questions from fellow commissioners. So I would ask that we move for a motion to adopt the mental health and workplace report and standards. I'd like to motion. Am I allowed? Can I motion that we adopt the mental health workplace?
So moved.
Thank you. So there is a motion and a second from Commissioner Carnevale. Jeff, I would ask that you please take roll.
Commissioner Bontrager,
Aye.
Commissioner Boyd, Commissioner Brown, Commissioner Bunch,
Aye.
Commissioner Carnevale,
Aye.
Commissioner Carrillo, Commissioner Chambers, Commissioner Chen,
Aye.
Commissioner Cortese, Commissioner Danovich, Commissioner Gordon, Commissioner Mitchell, Commissioner Rolette,
Aye.
Commissioner Tamplin,
Aye.
Vice Chair Alvarez,
Aye.
Chair Madrigal Weiss.
Aye.
Motion passes.
Excellent. All right. Thank you. Thank you for the conversations and thank you for the work. I am very excited about this work. I want to recognize that the most progress seems to be moving forward in the private sector. However, we can learn many lessons from the private sector, but I also want to recognize that for these standards to really take hold, they also need to be implemented in the public sector agencies. Anyone working in schools or with a child in school recognizes that teachers, school administrators, and school staff are essential workers. Not only was that made abundantly clear during the pandemic, it remains a fact during the current mental health crisis we are facing today with our young children and youth, our teens. As we move to implement this report, I want to ask the Commission to invest in workplace mental health in our local educational agencies. I have already shared the report with my leadership, and I look forward to working with Commissioner Gordon to put together a proposal that reflects the implementation of this work in county offices of education and district offices. The workplace mental health standards can serve to strengthen school systems where our efforts in student mental health can thrive. I know that not all of you were able to attend the Commission's initial Youth Innovation Conference at the University of California, Santa Barbara, but we did have student representatives there representing 5 counties in our state, including Imperial County, which we will visit next month. And one of the questions, and I think I mentioned this also in January at a separate meeting, but when asked young leaders what we needed to ensure, safer, stronger, more cohesive school cultures, they talked about how important it was that school staff are healthy if we want them to be able to best equip the support of our students. So more to come on that proposal. I just wanted to make mention. I think it's important that we also get into that public sector and start seeing some of this in our schools. So we are now moving on to agenda item number 7, where the Commission will receive the Innovation Incubator Evaluation Report prepared by Commission staff. The Commission's Innovation Incubator supports county efforts to improve results. The incubator was a key asset in the Commission's overall strategy to drive transformational change as articulated in our strategic plan. Given that the Innovation Incubator model was itself a promising but untested approach, the Commission launched an evaluation that began the summer of 2020 and wrapped up last year. The evaluation goals were to gauge the effectiveness of the model in enhancing collaboration and innovation, as well as to determine how to improve the model to facilitate greater innovation in the future. We are now going to hear from Melissa Martin-Mullard, Chief of the Research and Evaluation Division, and Courtney Ackerman, who is the Commission Research Scientist and who led the work. We are not scheduled to vote on this report because it is a report to the Commission, but we will have an opportunity to comment and explore how we might incorporate the lessons from this work into our ongoing portfolio. And we anticipate it will inform future discussions on uses of mental health wellness on the Mental Health Wellness Act funding and other resources. So Melissa and Courtney, I invite you to come to the table and we look forward to your presentation.
Thank you, Madam Chair. Good morning, and thank you for the opportunity to share the results of the Innovation Incubator Model Evaluation this morning. As Madam Chair mentioned, the Innovation Incubator Evaluation was in response to the Commission's 2020 to 2023 strategic plan, and specifically to the strategic objective 3A, which states, support and evaluate multi-county collaboratives striving to improve data analysis, the transfer of knowledge, and the management capacity required to improve results. In developing this strategic objective, there was recognition by the Commission that it is important to document the value of efforts to form and support collaborations to address specific issues, which in this case was the reduction of criminal justice involvement through a variety of programs and strategies. Some of these individual projects, such as the multi-county FSP project that were formed under the Innovation Incubator, are still ongoing. And at a later date, we hope to invite counties and their evaluation partners to come speak to the Commission and the public about what the successes and lessons learned were for those project-specific efforts. As part of the Innovation Implementation Plan presented during the November 2022 Commission meeting, there is an outlined strategy for capturing lessons learned for innovation projects more broadly, and our staff are beginning to work on those strategies. We look forward to an ongoing conversation about what we are learning and how we can continue to support counties around innovation. Today, however, we are presenting the findings of our internal evaluation of the Innovation Incubator model itself. I will now turn it over to Courtney Ackerman, who carried out this evaluation under the leadership and direction of Dr. Sharmel Shah and Ashley Mills. Courtney, I hand it over to you.
Thank you, Melissa. Good morning, everyone. My name is Courtney Ackerman. I'm a research scientist with the Commission. My pronouns are she, her, hers. I'm excited for this opportunity to present the findings of the Innovation Incubator evaluation to you today. I should have slides up, right? There they are. All right, but first I'm going to provide a little context on the environment of innovation. Innovation is the smallest component of the MHSA, accounting for 5% of the MHSA funds that counties receive. It is small, but the hope is that it is mighty. The aim of innovation funding is to explore and develop new strategies and approaches in mental health. The intent is that counties will use these funds to expand the tools in their mental health toolbox and make incremental but over time transformational change. When we talk about the innovation component, we're talking about two main subcomponents. First, the local county innovation projects that this commission reviews and approves regularly, and the Innovation Incubator Initiative. The Innovation Incubator was designed as a learning opportunity. The goal was to figure out how to best support counties in doing innovative work in mental health, both within and outside the official innovation component. It was established in 2018 with a $5 million investment. At the time, there was growing concern about the population of individuals who were deemed incompetent to stand trial. It is well known that people with mental health challenges are overrepresented in our criminal justice system, indicating that there is a need to reframe how our systems think about and treat individuals who are struggling. To attempt to address two problems with one initiative, the Commission organized the incubator around the common theme of understanding and reducing the overlap between experiencing mental health challenges and criminal justice involvement. To that end, those were the two main goals: to reduce criminal justice involvement in individuals with mental health challenges, but also on a broader level to build capacity for innovation within California's mental health system. 8 projects were established with the $5 million in funding, 5 multi-county collaboratives, and 3 projects focused on statewide goals, including identifying and taking advantage of sustainable funding streams to reduce criminal justice involvement, improving the process of innovation projects, and synthesizing and disseminating lessons learned from incubator projects. These projects were based on the incubator model, which was something different from our business as usual. Instead of contracting directly with counties, we contracted with subject matter experts in areas related to criminal justice and mental health. These experts worked with counties, delivering four key services. First, providing targeted technical assistance. Second, helping build capacity. Third, assisting with continuous quality improvement. And fourth, facilitating communication and collaboration, both among and between counties. With this model, the commission was able to retain ownership over the projects while also maximizing the potential of bringing in experts to guide the work. It allowed for greater collaboration between and among counties, commission staff, and contractors. It gave counties the option to join whichever project or projects aligned with their county's specific goals and needs, with pre-identified experts. It took the pressure of finding and contracting with these experts and the burden of managing the project off the shoulders of county behavioral health staff so they could focus on the content of the work. Given that the incubator was different from our usual projects, the evaluation was also a little different. Rather than typical program or project evaluations that focus on specific project outcomes, this effort was focused on evaluating the model itself. The evaluation was designed and carried out by a multidisciplinary team within the commission, made up of staff from multiple areas and functions. There were two main evaluation questions that guided our work. First, did the innovation incubator model help counties enhance their capacity for designing and implementing innovative practices? Did the model work? Was our first question. The second question was, how can the innovation incubator model be improved upon to build further capacity for innovation? So not only does it work, but how can we make it work even better? The evaluation activities included several opportunities. The first was a convening that we organized in August of 2021. This included staff from some of the key counties involved in the incubator projects and all of our contracted experts. To follow up on that, we organized a second convening, which we called a roundtable in October 2021. And that was in collaboration with our partners at the McGeorge School of Law. That included everyone from the first convening, plus some extra advocates, experts, and interested parties, so we could expand on what we learned from the first convening. In that same month, in October, we sent out a countywide survey, or statewide survey, excuse me, to all counties that were involved in an incubator project or multiple projects to gain their feedback. In December, we also engaged in a stakeholder collaboration meeting, and that was to get feedback from representatives of some key stakeholder groups on what information would be helpful for them to know related to the outcomes of this evaluation. Between December of 2021 and March of 2022, we conducted county exit interviews with all county staff who were involved in an incubator project or projects. And finally, we also conducted a couple of lived experience interviews. So these were conducted with individuals who were both involved in an incubator project and who also have firsthand experience as a consumer of mental health services or the family member of a consumer. There were several main insights gleaned from these evaluation activities. First, counties and subject matter experts agreed that the incubator model was an effective model. It allowed them the opportunity for greater collaboration and fostered innovative thinking. It also has some room for improvement, specifically in how projects are established, how partners are educated and informed, and how the project process is designed. Second, one of the most key findings was around relationship building. Strong working relationships were both vital to project success and a valuable outcome of the work within this model. We know that all work is stronger when project partners have trust and understanding, but this is especially true when it comes to doing innovative work. Third, counties are excited about opportunities to innovate, but they do not always have the capacity to take advantage of these opportunities. County behavioral health departments are stretched thin, and they don't always have the staff, time, or resources to engage. With some dedicated support from the state, they're more able to participate in innovation work. Along these same lines, we found that counties are hungry for opportunities to collaborate, learn, and share resources and information with each other and with state partners. The findings are clear that when we collaborate, we see better outcomes, and counties are ready for more collaboration opportunities. Finally, it's vital to include the voices of those with lived experience in the planning and implementation of these initiatives. They're often eager to contribute, and they bring an inside perspective that guides the work and ensures that project findings are not only relevant and reliable, but also applicable in the real world. On a broader level, there were several key takeaways for us at the commission. First, we affirmed that evaluating our internal processes and projects is a useful and worthwhile effort. If we want to see continuous quality improvement in our counties and across the state, we need to make the first move and provide an actionable model for them to do that. Second, the findings of this evaluation can be applied to the broader commission portfolio. The lessons learned can be applied to much of our work outside of just the innovation component, to all the technical assistance, capacity building, incentivizing, and community engagement work that we do. On a more technical level, we learned that there is a great need for the commission to foster and further collaboration and learning among counties. There are many opportunities available to us, including establishing more learning collaboratives and providing more chances for behavioral health staff, experts, and advocates to share information on project outcomes and successes. Our mission at the commission is transformational change, and transformational change requires greater collaboration, more engagement, and a focus on continuous assessment and improvement, both within the commission itself and in the state more broadly. Thank you for this opportunity to present these important findings. You can refer to the full Innovation Incubator Evaluation Report for more information, which can be found in the meeting materials packet and will be posted soon. I'm happy to answer any questions on the evaluation or its findings.
Thank you, Courtney. At this time, I would invite commissioners to offer any comments or questions. I can't see anything.
There's none on Zoom or in person.
None. Okay, so Courtney, you did an amazing job. Just the clarity, we are stunned with no questions. I would like to make comments. I appreciate everything that we have learned so far, and really the coming together of different departments and sharing best practices. I think it buys us time that we, that separately the different departments are learning. So bringing everybody together, I think, is just something that we know is the best practice. I know we do that for COEs. We are coming together and sharing our best practices. We're also sharing trends. We are moving forward in things that, we couldn't possibly have known separately. So I appreciate the work that's being led here, and hopefully we will continue this model of bringing forward and again, those, we call them communities of practice in schools. And so excellent work, and thank you for that. And still not seeing any other comments or questions that our fellow commissioners would have.
Chair, I'll just briefly in here because I don't want the lack of comments to lead me to care about this. And, I'm passionate about these, non-sexy things like innovation processes, but, being on the research and evaluation committee, this is fundamental to who we are and what we believe and what we're trying to do. And we have to be a learning organization if we're going to improve our impact on reducing mental health across the state and across the country. So I think this is essential. And just for a matter of context, 5% sounds small, but if you look at an average corporation, they invest 5 to 7% of their monies into research and development. That small amount is what fuels a next generation of innovation. So this is really important. Thank you.
Thank you, Commissioner Carnevale.
I can also add to Commissioner Carnevale's point of silence not being appreciation for the work and opportunity that we have. I think, I've learned a lot from Commissioner Danovich and his approach to ensuring our investments in innovation are thoughtful and really reflective of the intention behind innovation funding. And I think, a report like this helps us as commissioners really tell a more effective story of what these investments have meant for delivering of quality mental health services. And I'm really interested in even knowing more about where do we go with those learnings, to Commissioner Carnevale's point, what has been learned from these innovation projects, and as a result, what has been expanded. There's such incredible county collaboratives as a result of the innovation funding that we've been able to learn from over these years. And being able to tell that story effectively, I think is tied to our strategic plans, tied to being committed to those goals. So I'm excited to see what's to come from this as well.
Absolutely. Thank you, Commissioner Alvarez. At this time, I will go ahead and move to public comment. So Amariani, I would ask that you open the queue and we will start with any public comment that we may have in the room, and then we will move to virtual public comment.
Okay, so far we have one in the room, Josefina.
Good morning, commissioners. My name is Josefina Alvarado Mena. I'm the CEO of Safe Passages, also part of the California Reducing Disparities Project. And I just had a question about this particular analysis in the report. And I wanted to know if the question of the impact of the innovation funding on reducing behavioral health disparities among marginalized population was one of the questions that was considered in the analysis in the report. And if not, can that question be asked? Because I think, often innovations is cited as a source of funding that can support different kinds of programming that addresses marginalized populations, both racial, ethnic, and LGBTQ plus communities. And I didn't hear that in the presentation. Thank you.
So that's not something that was one of the main questions of this evaluation work, but it is something that is found throughout innovation projects. So that's something that as we continue to do more work on evaluating our innovation component, I'm sure we're going to hear more about.
Thank you. I couldn't see, was that Courtney responding?
Yes, that was Courtney.
Perfect. Thank you, Courtney. Are there any other public comments in the room?
That was the last in the room. And then we have one virtually. We have Emily, you can go ahead. Oh wait, actually try now.
Thank you so much for this discussion on innovations. Mental health in itself is a very heavy topic for most of society. And so I do applaud you guys' efforts in bringing in the arts and even, considering bringing in creating a space for the music therapy and for the API population. I just did a presentation for my city of Arcadia. It was an event that was put on a memorial concert for the victims of the Monterey Park shooting in Half Moon Bay. And, APIs, they do happen, they have more of an appreciation for art. And so I did a presentation on finding healing after tragedy and turning pain into beauty. RBG, she says, speak even if your voice shakes. So I continue to advocate even when my voice shakes. My father died 6 months ago. So I've been going through a transformational shift. And when my father passed away, the memorial, they asked me if I wanted the dying roses that were on his casket. And I chose to take the flowers and I created this. I plucked off all the rose petals and I made it into the shape of a heart as a way to commemorate my father, whom I love so dearly. And so when the victims, when the mass shooting happened, the Stardance Studio became a memorial site for many people in Monterey Park. And so when I decided to start cleaning up, and I saw many empty candles that had no wick, no wax, I saw some wilted roses and I started to create another heart floral mandala. And the Pasadena Star News was there. And this is the end result of what I made. Keep dancing, say hello to Twitch for us. You matter. My artwork, I've done 5 of these. And this was the 4th one. And this one got on the front page of the Pasadena Star News on February 1st. And, this is the way society is able to handle heavy emotions. And so I have been finding creative ways to heal myself. And I think this is like innovations, and I think when we are able to put together programs to help communities heal through the arts, through music,
Emily, your time is up, but thank you.
yeah, so thank you for facilitating these discussions on innovations, and I hope to work with any of you in the near future. Thank you.
Emily, thank you for sharing that, and sorry for your loss. Amariani, another call.
Yes, we have one last comment. Colin user 5. Your line's open.
Hi, this is Mark Carments again. Look at the Alternatives Conference of 2021. They had workshops with regards to with people working as peer supporters in the jails and to teach people who are incarcerated tools they would need when they get out of jail. Okay, this sort of thing was covered by Cal Voices as well, so you might want to take a look at that and look at those workshops and maybe incorporate it into the Mental Health Services Act, so that we, at a local level, can incorporate it into our community leadership teams and stuff like that, and into the process in the local area. And I also want to send my heart out to Emily Wu Chong for her loss, and I'm sorry about the people who passed away in Pasadena and wherever that happens.
Thank you, Mark.
My heart goes out to her.
Thank you, Mark.
We had one more comment come up. Let's see. Oh, no, maybe not. Okay, no, that was our last comment.
Okay. I'm sorry. Thank you. Thank you, Mariani. After public comments, are there any other comments from commissioners? I see none. Can't see the room. I'm sure you all would let me know. I'm sorry. Yeah. Okay. All right. Melissa, thank you. Courtney, thank you for that. We appreciate your time, and keep us posted, as I'm sure you will. All right, moving on to agenda item 8. The commission will hear a presentation on the prevention and early intervention report, Well and Thriving, and will consider adopting the report. For the second part of this item, the commission will be discussing future opportunities for establishing PEI priorities. In response to legislation in 2019, the commission launched a policy project to explore statewide opportunities for prevention, early intervention, and mental health. To lead the work, the commission formed a prevention early intervention subcommittee chaired by myself and Vice Chair Commissioner Alvarez. And vice chaired by Commissioner Alvarez. So same roles we have for the commission, we have for the PEI subcommittee. The subcommittee, with support from commission staff, compiled insights from community members and other experts with the latest data and research to develop a framework that outlines prevention and early intervention opportunities. That framework is outlined in the report, Well and Thriving. An initial draft of the framework was released publicly in August of last year. Under the direction of the subcommittee, commission staff revised the report to reflect public feedback, and during a subcommittee meeting on January 17th, we formally recommended that the report be presented to the full commission for consideration. The updated draft has been shared publicly and is included in the meeting materials. To be clear, the agenda includes an opportunity to adopt the report or call for changes in the report itself as it is. I know there are many people here to advocate for the commission to adopt new and or augment existing priorities for counties to consider when spending PEI funds. So I was hoping today that we can begin to discuss what the law allows and how we should explore that opportunity so that staff have guidance for time set aside in our upcoming next 2 meetings for that discussion, which is what we talked about in January. Yet I understand several advocates are calling upon some of our commissioners to encourage the commission to act. So we're going to figure this out. We're going to figure it out together because we want to have the conversation. And, you know, my role is twofold. You know, as the chair of the PEI commission subcommittee, I'm so sorry. And as chair of the commission here to facilitate this meeting. So I want to make sure that we have the conversation. I don't want, you know, I understand that there's correspondence, messages. We appreciate the last minute letters of support that have come in. Hopefully we got everything that came in time into your packages. So we want to put everything out there. Together we're stronger. We want to make informed decisions. So we are going to hear a presentation. I'm going to invite Callie Peterson to highlight the report and the work. And then we're going to discuss that report. But I'm also going to invite Chair Alvarez to kick off a discussion so that we can talk about the priorities, because I don't want to just leave this hanging, because that's not the right thing to do. I want to make sure that we talk about it together. I think I've mentioned this before, and I think in my conversations with Vice Chair Alvarez, you know, more heads work better together. So now that we have our commissioners here, we'll talk about this. We'll have a discussion around the priorities, and we will fumble through it together. So my fellow commissioners, that's where we will begin. I'm going to invite Callie to come share with us the report, highlight it, give us an overview. We will discuss that and we will move forward. I will be asking for support from staff because this is a little nuanced from the agenda, not new because I want to follow the rules, right? I think Commissioner Alvarez and I are kind of, how do we go through it? So we will ask staff to make sure that we do this right. So is that clear as mud? All right, right on. We'll get through that. So for now, I am going to invite Kelly. If you can come up to the desk and you will walk us through the history and goals of this project, of the report. And if you could just start by reminding the commission what the law requires and how this work relates to the commission's statutory obligations. All right, Callie, you're up.
Thank you, Madam Chair, and good morning, commissioners. Once again, my name is Kaylee Patterson. My pronouns are she, hers. Thank you for this opportunity to present the draft prevention early intervention report. Do we have slides available, Cody, to put up yet? Thank you. So at the request of the chair, Before diving into the report content, I just want to spend some time kind of orienting commissioners, reminding you of the history of prevention, early intervention under the Mental Health Services Act, and kind of the steps that led to the development of the report. So under current law, counties are required to use 90% of their MHSA funds to provide a variety of programs and services for prevention and early intervention, with the goal of preventing suffering and the negative outcomes that occur when mental health needs go unsupported. Historically, the commission has served a unique role in its ability to draft to author the regulations that give guidance to counties of how these programs are to be developed and implemented and then reported on. But even within this sort of guidance, they've still remained relatively broad, mostly because the nature of prevention in and of itself means that these approaches are more effective when they are tailored to the unique needs of communities. And so then you end up with a wide variety of approaches. In an attempt to bring a little bit more focus to the state's approach to prevention, early intervention, in 2018, Senator Wiener championed the Senate Bill 1004, which established a list of 5 priority areas to help guide the use of local PEI funds in counties. And in addition to establishing those priorities, expanded the role of the commission. One of these ways is it authorized the commission to establish these priority areas that were identified in the bill itself. It also authorized the commission to develop a strategy for monitoring, evaluating, and then providing technical assistance to help guide progress towards these priorities. These priorities were intended to guide, not necessarily dictate, the way that programs were delivered in counties. And so, as a way to kind of balance this tension of when the state should be determining how counties use their funding, and then also when it's more appropriate for communities to create their own priorities. The bill allows for some discretion. So counties actually reserve the right to identify their own priorities in order to meet the needs of their communities. These can be in addition to the priorities in the bill or in lieu of them. So there's a lot of flexibility already built into the bill. And that was intentional. Another role of the commission is that it was given the authority to identify and establish new statewide priorities. And this has been a really big focus of this process, as the chair pointed out. Now, this part of the bill is really established so that, as understanding of opportunities for prevention or early intervention evolve, and as needs of communities evolved, we want these priorities to be flexible so that they can adapt and evolve along with those changes in needs. And so really that this piece was not necessarily to require the commission to establish new priorities right away, but that it would serve as this mechanism to kind of, allow this flexibility moving forward. So following SB 1004, the commission in 2019 established created a subcommittee that was included Chair Madrigal-Weiss and Vice Chair Alvarez to start to explore these opportunities for prevention, early intervention. And really quickly, what the subcommittee came to understand was that before it could start to implement the directives under 1004, what the commission needed and what the state needed was this really foundational framework that would help, instill this shared vision of what these priorities are, which are very broad in prevention, and then also to help, guide decisions going forward, including the prioritization of funds. That framework is presented in this report through 4 findings and recommendations. These findings and recommendations emerged from a robust process of research and public engagement that was led by the subcommittee. A draft of this report was first released in August of 2022 and has since then received a good amount of written public feedback. The subcommittee held 3 public meetings to hear verbally feedback from the public and has done its best to incorporate that feedback. And I just want to take a moment to thank our public partners for taking the time and being, supporting that process along the way. In January, the subcommittee recommended that the draft report be presented to the full commission for consideration of adoption. As the chair pointed out, there are key concerns regarding the process for identifying priorities that remain unresolved. But with that being said, the hope is that for the commission to see the utility of the framework presented in this report to guide that discussion and decisions around priorities now and in the future. So I just want to spend some time talking about the subcommittee's process. In 2019, the subcommittee started with, in what is more traditional at the commission is, going into communities and having these public meetings with around these opportunities and for prevention and asking the public to share what their needs are. Quickly, COVID hit, and so things slowed down a bit, but really what this did was give the subcommittee an opportunity to leverage, this virtual platform to reach more people across the state. So together, the subcommittee and staff engaged in over 50 hours of public events, reaching over 800 Californians from diverse communities, particularly in communities that are traditionally underserved, and really spending a lot of time hearing and talking and listening to the concerns and the needs of Californians. In addition to, outside of the public events, staff spent hours, researching the literature, interviewing experts in the field, both locally and internationally. They also took some time really diving into the data we received from counties, included 850 PEI programs in California from the program and expenditure reports that counties submit to the commission. Now, while this process did not result in how these needs are shaped by the places where people live, work, play, age, and receive care. And then how disparities are really existing because of the fact that people are not thriving in these environments. This was something we saw pan out during COVID. It's sort of in real time, as socioeconomic disparities really were amplified. We saw a direct sort of correlation to a decline in mental health. So it was really an interesting time to be engaged in this work. So, as needs are broad, the opportunities for prevention and early intervention are equally broad and expansive, and really require this approach that includes primary, secondary, and tertiary prevention strategies that can address these really upstream factors and the social determinants of health, while also making sure that we're preventing the negative outcomes for people who are experiencing mental health challenges. This is a common framework that we see a lot in what, our traditional public health system. It's helped communities and societies address, major health concerns like diabetes and HIV and tobacco use and even the COVID pandemic. Mental health is a little bit behind, and yet we don't have this framework yet that has been operationalized at the state level anyways, to start to really make the similar type of impact that we see in other domains of public health. This slide here is kind of just a way to show how the commission actually has already started making progress and moving towards this public health framework. We see how its various initiatives kind of map out across primary, secondary, and tertiary prevention, focusing upstream, such as through its school mental health initiatives, workplace mental health, as you learned about today. Our peer work really critical for this secondary prevention, early intervention, preventing, but also a lot of these work across primary, secondary, and tertiary. So this is not, there's a lot of overlap here, but this is just one way of looking at the way the commission is supporting this framework already. And because of this, should the commission decide to adopt this framework and this report, it would be a way it could actually strengthen the work it's already doing. And then it would form, decisions going forward to start to fill in these gaps. All right, so now I'm just going to take some time to go over the specific findings and recommendations that emerge from this really robust process. So, finding one really gets to what I've kind of already been talking about and really lays out this need for this broader strategic approach for a statewide prevention, early intervention that, is capable of addressing these really underlying socioeconomic structural conditions that underpin mental health inequities. And the recommendation is that the governor and legislature really establish a foundation through leadership, and that leader should create this plan, and that plan should be tied to clear and compelling goals for standards of well-being that are centered in equity, diversity, and inclusion. The recommendation includes building investments to strengthen, or building on the state's investments to strengthen the role of communities in decision-making, capacity for data strategies, and then also building out technical assistance to support this integration of a robust sort of multidisciplinary prevention approach. In finding two, it really brings a sharper focus to what are these key drivers that are currently driving risk in mental health. During our public events, we heard a lot about how Californians really are struggling to meet their basic needs. And this is a major stressor, not only causing risk in mental health, but also sort of preventing this really necessary resilience to such as when things like, the COVID hits, when they don't have those basic needs, it makes it really difficult to cope and then just further increases this risk. And that until, the state addresses these disparities in basic needs and combats trauma, our efforts in prevention or early intervention can only go so far. So really, we need that really upstream approach to support this work. The recommendation is that as part of the state's strategic approach to prevention, early intervention must address these risk factors with particular attention on trauma, and then start to build out the resiliency in communities, such as, like I said, building, ensuring basic needs are met, and bolstering the role of our environments, of cultures and caregivers in promoting and protecting mental health, recognizing the importance of, caregivers to support resilience, not just for children, but for our aging population, people with disabilities and our most vulnerable populations. And then also recognizing, that, like I said, the role of culture and forming this sense of belonging in a community and structuring our environment to support that. And doing that in various ways. Finding and recommendation 3. Oops. So in this finding, it really highlights that people who are well-informed are better able to support their mental health needs, and they're better able to support the needs of others if that is necessary. Information also empowers communities to engage in events such as this, drive change and be and participate in this decision making that impacts their mental health. But the finding is really that California really needs to do more in terms of investing in strategies to improve awareness, combat stigma, as we've heard a lot during discussions today, and that really, things like media and sort of misinformation are continuing to drive misconceptions in the absence of, robust sort of public awareness strategy. The commission or the subcommittee recommends that as part of the state's strategic approach to prevention, early intervention, it must promote mental health awareness, combat stigma, and to do so by ensuring every Californian has access to the information, resources necessary to support their own needs, focusing on key settings where people engage with people who have mental health needs, such as, in healthcare settings and criminal justice systems, and then also building mental health into our standard curriculums, or mental health awareness into like school curriculums in the workplace, as we heard earlier, in the workplace mental health standards, really enhancing awareness there through training and various other resources. Finding and recommendation 4 kind of lands us on what we refer to as tertiary prevention. So recognizing that prevention is also, even though we want to do upstream as much as we can and prevent as much as we can, prevention also happens for people who have a mental health challenge, in that we want to prevent, the unnecessary suffering and a lot of these negative outcomes that can occur when a person's mental health needs are not supported effectively. We heard a lot, people, and this continues to be something that is brought up in time and time again, that people are really can't get care. Even people with insurance can't get care. And when they do, there's a delay. And we know that that when mental health challenges are identified and supported early, outcomes improve. And yet we have yet to, move services in the right direction. The lack of culturally and linguistically appropriate and responsive and relevant services are also a major barrier. And also our fragmented systems of care create additional challenges. So there's a lot to do here. But fortunately, the subcommittee has recommendations that would help to resolve some of these barriers. So one of them is to ensure that universal mental health screening and services are available for everybody. Screening is responded to with services that are provided in the places, in the languages, and in the ways that works best for people. This includes services that are integrated with supports in communities to continue that continuum of care and support recovery. It includes you know, leveraging the value of peers in these services. And it also includes considering ways we can really investing in strategies that will help to reduce these disparities, including approaches such as community-defined practices, which have been really elevated throughout this process. So again, just really, closing this continuum of care by enhancing our systems of care. So, together, these 4 recommendations are immensely broad, and there's a lot of work to do, but really the subcommittee recognized that, and before we could start to talk about priorities, we really needed to map out what these opportunities were across this continuum. And some of this work will take a lot of time, but there are steps that can be taken now. Consistent with the commission's role, should it adopt this report, one of its next steps will be to start talking about ways it can implement these recommendations. And the subcommittee has been working with staff to start to outline some of these opportunities through, using its various resources that it already has to continue its efforts to promote awareness, build out its capacity for technical assistance, and strengthen its data monitoring and evaluation efforts, and doing so in a way that aligns with the directives of SB 1004. So, the process for establishing priorities is definitely one of the first things that the subcommittee will consider as it as it takes its next steps, and whether that's today or in future meetings will be determined soon. So very excited to see how this translates into next steps and action. I just want to quickly let you know that there's so many resources that went into this report that support this report. Most of them are found on the commission's webpage. On the Prevention and Early Intervention Initiative page, we have our listening session summaries, our forum summaries, the report, our implementation opportunities draft. There's also links to Senate Bill 1004. And I encourage you all to explore those resources.
Thank you, Kaylee. Appreciate that. Okay, so this is what I would like to do. I am going to ask my fellow commissioners, and this is where it's going to be a together decision, okay? I would like my fellow commissioners to, so next what we would do is have a discussion and see if there's any question or comments on what Kaylee just presented. So is the report as it stands. I do want to have the conversation and invite Commissioner Alvarez to kick off that conversation regarding the priorities, new or modification of priorities. But I don't want to confuse, like, do we start talking about the report as Kaylee presented to us, if there's any questions or comments on those, and then we'll have the discussion around the priorities, or go into the discussion about the priorities and then have a discussion on both. So we could start with, thank you, Kaylee. If there's any questions or comments on the report as stands, and then we can have, we don't have to take the vote yet, nothing like that. Just let's have a discussion on what Kaylee said, or have the discussion now. So I would ask my commissioners if I could see my commissioners and say, which would we prefer to do? I'd want to make this, please, Commissioner Bunch.
I want to clarify, I guess, and because I don't know how we have one conversation without the other.
Okay, so you would prefer to have both conversations and then discuss the report?
Yeah, because I think discussing the report without addressing kind of what we all know needs to be addressed is ignoring a really big element of what's going to go on today.
Gotcha. Thank you. Any other thoughts? Commissioner Alvarez, please.
I would completely agree, Chair Madrigal-Weiss. I think there's no separating the conversations given the breadth and scope of the report and what it addresses as far as the many challenges. I think if we can have it all at once, and my comments connect the two anyway, so I think it would be helpful to just open it up for a broader discussion.
Thank you. Any other thoughts?
This is Commissioner Rolette. I agree with my colleagues.
Okay. And I don't see any other hand. I appreciate all of you sharing that because it's not aligned in the agenda and I don't want to make decisions solita all by myself. I want to hear, let's do this together. So with that, Kaylee, thank you. Stand by because we will come back and discuss it all together in the end. Then Commissioner Alvarez, let's go ahead and get this party started.
Thank you, Chair Madrigal-Weiss. And I want to start by really thanking, actually seconding what you said in your opening comments about this work and express my deep appreciation for the incredible effort, the years of effort that went into the development of this report. Of course, I want to appreciate the work of the staff of the OAC, Kaylee and Ashley and many others, but also to the many advocates that have shown up time and time again to express the views of their communities and in this important effort. It has been a collective discussion and a learning journey for so many of us, and just really want to extend heartfelt appreciation for those of you that have been here and have shown up time and time again. As outlined in the report and in Kaylee's presentation, the challenge around prevention and early intervention really, it's incredibly complex and intersectional and grounded on centuries of systemic racism and depression. And in response, this report really does include some specific calls to action for joint leadership across the many systems, agencies, and partners that exist to support our children, our families, our communities, and their mental health and well-being. And I think for those of us that are part of this commission, that have the privilege to be a commissioner, we are one of those agencies that has an opportunity to do better and to create the systems change that will advance equity. And I fully believe that we're going to do that through adoption of this report, but also through adoption of an implementation plan, through accountability to what that implementation plan looks like, and even more. And I think of what we'll hear from folks today is one explicit opportunity is the priorities around prevention and early intervention. To Kaylee's point, the report does not specifically list the PEI priorities outlined in SB 1004, but we as a commission have already communicated these priorities to counties. And therefore, with that communication, we've adopted those. And we have then the authority to amend those priorities. And really to play, I think, the commission's unique role in providing guidance to local counties regarding the Mental Health Services Act. I think that's the question that we want to make sure we have as a commission. But given that we've already issued some form of guidance, we should then be able to update that guidance reflective of the conversation we're going to have today. At the appropriate time, I would love to be able to make a motion to change those priorities and add language around the 2 points that we have heard time and time again around. One is adding language that prioritizes all transition age youth, not just those in college. And 2, adding language that prioritizes community-defined evidence practices under the culturally competent language. During the 50 hours of meetings that the subcommittee hosted, we heard over and over again the importance of these shifts in language to respond to the needs of impacted communities. We've heard them supported by a wide variety of organizations. I will say many of them are the statewide advocacy partners that we work with regularly, but we also heard from local providers and local representatives of BIPOC communities, LGBTQ communities, from both rural communities and urban areas, doing the incredible work to support our community's mental health. We also heard from many of our behavioral health organizations at the state level. Both government and private entities support these recommendations. And two of our own subcommittees, one of which I've had the privilege to chair, and I know Commissioner Tamplin has shared the other, that are comprised of experts we've identified that serve racial, ethnic, and LGBTQ communities, as well as experts with lived experience, consumers, and family members. These committees, our Cultural and Linguistic Competency Committee and our Client and Family Leadership Committee, both have formally voted to adopt the changes. And so there are questions about where we go from here. And I think, Chair Madrigal-Weiss, I know how incredibly passionate you are about holding ourselves accountable to the change that we say we want to make. And I think this shift in language and priority setting will help us head in that direction. But I also want to acknowledge that there is far more work to do to implement these changes and make it come alive. As part of implementation of the report, I hope that we explore reviewing and revising our PEI regulations with respect to data and what is collected and reported by counties so that we can compare apples to apples and really, again, tell a more effective story of our investment. Data does tell that story. And as you and I have discussed at length, it's a critical leverage point to better understand impact, better inform our direction, and ensure we are strategically allocating our resources. I'm really looking forward to the conversation today and hearing from our fellow commissioners, hearing from additional advocates, but more importantly, continuing to work together to put our commitment to equity into action. So thank you.
Thank you, Vice Chair Alvarez. Other commissioners, please.
This is Commissioner Bontrager. I guess Vice Chair Alvarez said exactly and more eloquently anything I could say. So I just want to echo exactly what she said. Thank you for raising that.
This is Commissioner Rolette. I want to again ditto the remarks by Vice Chair Alvarez. I will hone in on again as Vice Chair Alvarez indicated, the two subcommittees that have endorsed the additional language. That is not a detraction from the work being done by staff, but certainly it speaks to what I believe is our responsibility to be reflective, contemplative, and then to make recommendations that are reflective of constituents' notions, ideas, and that influence the work that the commission does. Again, I'll go back to the staff has done a great job in putting together this report, as Vice Chair Alvarez has said.
Thank you, Commissioner Rolette.
I have a question, I guess, wanted to clarify. It sounds like I'm hearing that multiple commissioners are in favor of adding this language that has been suggested. I guess my question is around, and Vice Chair, you mentioned appropriate time. I wonder if we can kind of clarify what we mean by that.
I'd like to do it today. I mean,
oh, okay.
I'd like to do it today. You don't see me looking at you, Jeff, but I'm looking at you, Jeff. It's my understanding, and I'm not a lawyer, that SB 1004 created this list of priorities. The commission in January, I think of 2019 or 2020, sent out a guidance to counties outlining those 10 priorities. So technically, they're adopted. And technically, we then have the authority to amend those in order to clarify these two changes. Is that a correct understanding? Am I the only one that can't hear Jeff?
No, I can't hear him either.
Jeff, you're on mute.
You're still on mute, Jeff.
We can, no.
We can hear you now.
Yeah.
So we're waiting for Jeff to answer whether or not we can amend the language today. Is there anyone else that can answer it, or is everyone that can answer that question in that room with no?
I would prefer that staff answer it. So yes, pretty much everybody's in the room that could answer. Well, you know what, Toby, I don't know if Toby is in. Toby's been out ill, so I don't want to put pressure if he can't speak or not.
Vice Chair Alvarez, this is Maureen Riley, Assistant General Counsel. I'm not sure, Jeff, have you tried unmuting again? You did, and then you muted back.
So Jeff, could you call in, maybe go into one of the staff rooms and call in?
Yeah, the problem is that if Jeff uses his computer microphone, then we'll get the feedback, which is why he's trying to use the microphone in the room. This is Toby.
Okay.
Apologies.
Oh, okay, Toby, could you answer the question?
Yeah, and so I will want confirmation from Jeff, but so the law required the commission to adopt a set of priorities, which, as Vice Chair Alvarez pointed out, and we had a deadline, a statutory deadline to do so. We sent out an information notice to do that. And as Kaylee pointed out, the law allows the commission to modify those priorities. What's unclear is if we can modify the priorities that the legislature adopted. It's not clear that the commission can overwrite the legislature's priorities, because we are required to adopt the priorities that the legislature included in the statute. We can adopt, however, additional priorities. And so, Jeff, if I'm close, just give us a thumbs up unless you can speak.
I think
there you go, Jeff.
Do both. I've gone into another room. So I think everything you said was absolutely accurate. There are prescribed priorities in the law. There's also permission for the commission to add to those priorities. And as Kaylee said earlier, counties can also enact their own priorities. There's also a provision in the law that exempts rulemaking for such a provision, and therefore this commission could in fact act as it so desires, either today or in the future, to add priorities to the existing statutory priorities. So the answer to your question, as I understand it, Vice Chair Alvarez, is yes.
Yes, adopt new.
That it's permissible.
It's permissible to adopt new.
Correct.
So we have to leave those standing and then adopt new, not change those standing, correct?
Yeah, the law is very specific and says the commission shall adopt the following priorities, and then it gives permission to add additional priorities, as Toby said, in addition to those that are statutorily listed.
Got it. And then, okay, got it. Are we clear? We got that? It would be new.
Yes, if I'm understanding, then the motion would not be to augment the existing priorities, but to add 2 additional priorities, one focused on transition age youth not enrolled in college, the second on uplifting community defined evidence practices.
Correct. I'm not sure I see a significant legal difference in your question, but yes, you would be adding to the statutory priorities.
I guess the substantive legal difference is, can I just add 2 words to an existing priority versus a completely new priority?
Hi, this is Cody. Can people on Zoom hear us yet?
Yes, we can all hear you.
I think our problem is solved, Jeff.
Okay, thank you. You would not want to augment existing priorities. You would want to add to them because the law is very prescriptive. It says the commission must adopt the following priorities and then gives permission to add to it. So my recommendation would be not to augment existing language or existing priorities found in statute, but to add additional language if you so desire.
Okay, that's helpful. Thank you.
Commissioners, this is Toby. Part of our other concern was that the Mental Health Services Act itself includes 7 priorities in PEI. And those are mandatory. They're not discretionary for the counties. The 5 priorities that were outlined in the legislation are discretionary on the counties. And so part of the reason that we were hoping to first adopt the report, which provides a framework, and then as part of the implementation plan, discuss the potential for priorities, was that the report provides a foundation for thinking through those options. And wanting to put those priorities in the context of the tools and strategies the commission has, like the Innovation Incubator, to really drive change in those areas that you've identified as priorities. And so again, it's complicating it a little bit, but it really was to set up some context to think about what does it mean to adopt new priorities relative to what the law already requires, and in some cases, lack of attention on those priorities as they exist today.
So I think that is where a couple of things. When we hear, that the priorities serve to guide and not dictate, that to me is just loud and clear. With the framework, we were trying to set up, be more conscientious of that fact in and of itself, that they serve to guide and not dictate the work. And when counties, at the end of the day, are able to have the flexibility to create their own anyways, I think that's the other point of if we, everything that we heard, why we spent the time, how this is a framework, it was really to strengthen the overall PEI work across the state. So I think that's where it wasn't just about let's identify 2 more that are important. I want to be really clear, have never disagreed that we should include all youth, not just those, all TAY youth, not just those in college. Understand that in and of itself is building upon disparities, not making change. Understand how important CDEPs are. It is, how do we then, do this in a way that's going to be relevant and create true change? And so I think, Commissioner Alvarez, this is where you and I have talked about, right? How do we do this in a way that's going to be meaningful and relevant and have a place that we create those systems that are going to support it? How do we do more than beyond make it a list, but how do we create that system where it's going to have true impactful change? And so if the 7 priorities, the additional priorities that we could identify are more discretionary, then it goes back to without context, without identifying that full-on system, then counties can still choose to not have it land there. So I think that was part of the discussion, and I understand where our partners are with this and why, it's important to have the discussion. So we talked about too, what we talked about in January, how just wanting to understand all the priorities and all the opportunities we have to achieve the goals, including, you know, the Mental Health Act funds, our FSP work, the priorities we have for, you know, innovation, and think and understand, you know, I don't think we're even clear where we stand with the 7 priorities that Toby mentioned. You know, we're not even clear where we stand with those, and then moving forward. So, and I'm just thinking out loud, right? Because they want that, you know, to have that dialogue with our other commissioners. Any thoughts on that?
I'm not sure that adding the language or expanding the language actually takes away from this idea of guiding as opposed to dictating. I mean, it's still, you're still guiding. I just, and this is kind of where and we haven't been able to talk about it, but this is where I've struggled, because I do feel like we all agree with this language. Like, we all agree that we should focus on not just college age,
right,
TAE, but all TAE. So I struggle with how adding this takes away from the bigger picture. And what is it hurting to add it? That's what I keep trying to understand.
Yeah, no, I also agree that maternal mental health is a priority, and fentanyl overdoses are a priority. When we are losing 1 in 5 kids of ages 15 to 24 are priorities. And so that's my question, right?
Why this one? Why this one? Right.
Right.
And the second one is harder to answer that, but for the first one with the college age youth, to me, we're adding it because it's already been specified for this one group.
Yes.
That
Yes.
is very specific and does not include our minorities and people who can't afford to go to college. So I say add that because it's already there. It's not something that, you know, why not this one as opposed to this one? It's adding the language because it's already been put out there.
100%, 100%. And again, this is why dialogue, I 100% could not agree more. Sorry, could not agree more. Yes,
Chair Madrigal-Weiss.
please.
Here's how I reconcile this, because I find this is a very funny discussion, because I think we're mixing up apples and oranges here. I think we're all agreeing, but I don't know what the original intention was, but PEI to me are tools and strategies to accomplish something. And you don't do that by identifying different populations. I mean, this body by definition serves all of Californians, and I don't think, you know, defining population segments is the right way to establish strategies, period. So I'm fully in favor of agreeing that we should include everybody, but that doesn't mean that necessarily changes anything. The strategies, the PEI strategies that we choose should be based on evidence and should be identified based on the most effective and efficient strategies to accomplish our objectives, which of course is to improve the mental health care in California. So I think we can do this all together, but just recognize they're different. They're not really in conflict. That's my opinion.
Thank you, Commissioner Cannavale. I could not agree with you more. I think it's the pick apart that has been the issue. And I think that every one of us agree that it's about all Californians. And Commissioner Alvarez for lifting this and saying, you know, let's add this language so that we can move this forward. My question then would be, how do we move this forward? Because is it a part of the report? And I guess I'm going to go to staff. I appreciate everybody's comments. And you're right, Commissioner Cannavale, we want it to be for all. And I think that we agree on the framework, if I'm not mistaken, because I think we've laid out what the recommendations are and what we want to see happen. So by adopting the 2 recommendations that we have heard and acknowledge, again, nobody disagrees. If we're to adopt the two new, as Jeff is recommending we would need to do, and adopting the report, what would that look like? I guess that's right. That's what we need. That's what we would need additional guidance on. Is that right, Commissioner Alvarez? How would we do the report and adopting two
Yeah.
new? How would we do that?
And to that point, I'm not sure we need an action because the information notice was done without commissioners knowing. It was run-of-the-mill practice, right? It was staff work. It was implementation of the law.
Yeah. One thing's adopting the report, and we said discussion of the priorities. So
Yeah, so can we just ask staff to do that, or is a formal vote necessary? Either way, we can do it.
yeah, I think we. But
Madam Chair, this is Jeff.
Please.
May I opine? The law prescribes the five initial priorities. The commission did send a notice, and it reiterated those five existing statutory priorities. If you're going to create new ones, I do believe you would need to do it through commission action, either today or sometime in the future. Your vote could be to direct staff, to do so, but you would need to have an affirmative vote, in my opinion, of the commission to adopt or enact additional priorities. That would be a separate vote from adopting the report.
That's super helpful, Jeff. Thanks.
Mhm. And we could do that today.
Yeah, we have agendized the PEI report. We have agendized the priorities as an informational item. I think that you have discretion as commissioners as to whether or not you think that adding the priorities fits within the subject matter of the report. And if so, you could take the action today.
I would prefer to take the action today and ask my fellow commissioners to consider that.
Yeah, I support that also.
Is that a motion?
So I think we're asking for support. I think it's clear it's supported. So then we would need, if you want to draft what that would look like while, okay, let me think about this. If you want to draft what that would look like so that we can make the motion, Jeff, then do we need to discuss that motion?
Yes.
Okay,
I would
so
recommend-
can we help us draft that? And then we're gonna have two separate motions, the adoption of the report and then the adoption of two new priorities. Is that correct?
Yes.
Okay,
Yeah. you
and
can-
then,
Go ahead.
I'm sorry, Jeff, I don't mean to interrupt. And then do we need to do more commissioner comment, or I think we're clear, then we can open up to public comment for both items?
You certainly can. Yes, Commissioner.
Okay, so let's get a motion for the adoption. And Jeff, do you want to help us with the wording, or do we have the wording? Commissioner Alvarez?
Absolutely. The first motion I would tackle, because it'll be a lot easier and simpler, is the adoption of the report. And so I would do that first, and then we can take the additional priorities either individually or collectively as a motion. And I certainly can draft them while we handle the report motion.
Okay, so let's open up public comment for the report just for the report at this time, and then we will open it up for public comment on the 2 new priorities. Yes, and that'll give us time. So first, public comment on the adoption of the report. Okay, we're gonna do that. Okay, I knew we'd do this. All right, here we go. So I am going to ask for open public comment period for this agenda item, the adoption of the PEI report. Well and thriving. So Mariani, if you could please open the queue. We are going to ask you to please limit your comments to 3 minutes. Please remember, this is just for the report. We are working on the adoption of the 2 new priorities, and we will have public comment on that next. So are there any public comments in the room? If so, we will start with those, and then we will move on to the virtual public comments. Mariani, please.
Chair, actually, so folks have already turned in public comment cards for this item, but they haven't differentiated what it's for. So all the comments are kind of just in for the general item.
I wonder, for sake of time, is it possible for them to just do their comment together?
If I might.
Tell me, Jeff.
You certainly can have one discussion, as I think you had outlined from the very start of this agenda item, take all public comment, and then we can handle the motions at the very end if you'd like. We just need to handle them separately.
Okay, we'll handle the vote separately, but we'll take the comments now.
That's what I recommend.
Okay, I appreciate that. All right, then we are going to start with the public comments in the room first, please.
Okay, we have 9 in-room comments. The first one is Josefina. You can go ahead.
Good afternoon again, Commissioners. My name is Josefina Alvarado Mena. I am the CEO of Safe Passages and the chair of the CRDP Sustainability Committee, although I'm not representing the State Department of Public Health today. I really want to thank you all for hearing us, for taking up the issue of augmenting or adding to the priorities. We've made literally hundreds of hours of public comments and submitted many, many letters to this effect. You've heard me say on several occasions about how much I wanted my children to be the generation of children that did not have to face racial, ethnic, LGBTQ+ disparities in the area of behavioral health, and how sadly that's not the reality for my children. It's not the reality for the children that we serve at Safe Passages. But it doesn't have to be the reality for the next generation of children. So I really urge you to vote yes to add the 2 new priorities that we have been articulating over more than over a year now, and be that change that we need in terms of creating greater equity for our populations. I'm a lawyer and a mother. It's very clear that behind the social determinants of health are the laws, the policies, the guidelines, the guidance. But behind all of those things are the people that create them and uphold them. And today, you all, the commissioners, are behind the guidance that can make the change, that can really create greater equity for our children. And we also know that 80% of California's children, kindergarten through 12th grade, are children of color. So this will greatly augment the MHSA's ability to serve all Californians. Thank you so much.
Thank you, Josefina.
Next, we have Alfonso.
Good afternoon, Commissioners. My name is Alfonso Silva Piontek, and I am here, I use he, him, his pronouns. And I am here as an intern with Safe Passages, but also as an advocate for youth that are in foster care. I myself was in foster care when I was a youth, and I know that a lot of youth do not have a lot of support to go to college. And so I very much appreciate you thinking of all Californians, thinking of all TAY youth, all transition age youth, to be able to have this kind of support. Because many are not able to go to college, they're really like staying behind. So we really have to do better to support these youth. In addition to that, I think we really want to think about CDEPs and how they are more specific and really take the feedback of their communities to provide appropriate interventions. And so I strongly urge you to add to the language so that all transition age youth have support and so that CDEPs are also being considered. So I urge you to vote yes today. Thank you.
Thank you.
And next we have Nikki.
You don't need to hear 3 minutes from me on this. So thank you. Oh, okay. I'm Nikki. I was involved in CRDP phase 1. I am the, okay. All right. I'm Nikki King. I was involved in CRDP phase 1. I was the lead for the African American portion of the phase 1 report. I am the president of RENCO, and I am an emerita from the University of California, Davis, where I look at the result, where I have had the opportunity to look at the results of our lack of care for our youth on a day-to-day basis for 35 years. And we've got to do something to change this. So thank you much.
Thank you.
We next have Avery.
Hi, Commissioners. Thank you so much for giving me the space to provide public comment. I'm Avery Hulag Vicente. My pronouns are she, her. I am with CAMPRO, the California Association of Mental Health Peer-Run Organizations. I identify as a mental health peer consumer, and I have lived experience. Over the last few months, alongside with many of our MHSA partners here in the room and on Zoom, we've met with many of you individually and through committee meetings and in commission meetings to advocate for these priorities to be adopted. Speaking to the PEI priority regarding transition age youth and the prioritization of college youth, there are so many ways that this priority perpetuates the barriers of access to care. It disproportionately excludes communities of color, foster youth, transition age youth, and vocational schools, and other marginalized communities who are unable to attend college or stay in college. I am an example of an individual who would have been excluded from these priorities if they were not to adopt our recommendations. My third year of college was interrupted by a severe mental health crisis, and I wound up on a 5150 hold. As you can imagine, this was in the middle of a spring semester. Who would go back to college feeling able to finish strongly? And college took a huge backseat for me. It wasn't until several years later that I found my balance of financial and emotional stability, along with a strong support system, to find myself to return to college while managing my mental wellness. Prioritizing college youth eliminates so many individuals who need these services. Second, mental health care does not look like me. And I agree that services need to be more culturally and linguistically appropriate, but anything considered diverse or inclusive falls under this buzzword of cultural competency. When something encompasses everything, it means nothing, and the intention gets lost. The counties need guidance, and true cultural competency exists when the work is done with intention. And in this case, it's in sustaining and promoting the work of and effectiveness of CDEPs. So taking action today is a step in the right direction. Adopting our recommendations says that the Commission is choosing to reduce barriers that marginalized communities already face in addressing our mental wellness. And please vote yes with intention. Thank you so much.
Thank you.
And next we have Joel.
Good afternoon, I think. Have we made it to afternoon? Maybe good morning. Hi, y'all. I'm Joel Baum. I use he and him pronouns. I'm also with Safe Passages, although I've spent many years as a middle school educator and also with an organization called Gender Spectrum, working with trans and non-binary young people and their families. I too want to echo many of the comments. I so appreciate Avery specifically saying when we say everything, we end up saying nothing. Yes, all Californians need to be supported, but the only way we find out if they're being supported is when we start counting. And when we count things, whether it by race, whether it by ethnicity, whether it by any other indicator, we see that not all Californians are being supported. And so I just really want to make sure we don't take a colorblind approach, right? The idea of, oh, I don't see race, I don't see gender, I just love everyone. That doesn't work. It never has. It has only worked for people who look a heck of a lot like me, that are white, that are male, that are educated, that have class privilege, right? That are English speakers, that are able-bodied, that are heterosexual, etc. So I want to just really emphasize the importance of language here. My dad used to say, talk is cheap, but liquor costs, right? Don't tell me you're going to buy me a drink, buy me the drink. However, talk is not so cheap that it doesn't matter. And a commission such as yourselves, with the authority and influence, and indeed the degree to which you've really taken this up, and I want to appreciate that, right? And the chair and vice chair and everyone on this commission really taking this up authentically. I just appreciate it. It's like, wow, democracy, look at that. But I want to say that words do matter, and words that come from groups like yours, in particular, commissions such as yours, matter a heck of a lot. And while they may be recommendations to the counties, they do carry weight and they are important. And you're standing up in the way that I've heard most of you say, yeah, of course, is meaningful. So I want to encourage you to vote yes. I do want to encourage you to think about voting yes on the priorities before the report, because the report includes language that does reference the priorities as currently written, and they do not mention specifically priorities related to non-college age youth and the CEDAPs. So I would encourage you to think about that sequence, but otherwise, please vote yes on both, however you choose to do that.
Thank you.
Next, we have Mia.
Hi, my name is Mia Bray. I'm an intern with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. And I too would just like to request that the commission pass a motion today regarding the approval of these two recommendations put forth by the CRDP, REMCO, and many other organizations, including some county organizations. What we're asking for today is completely within the bounds of your role as commissioners, and just to say this is exactly why the commission was formed, to make decisions that are tough like these. And in regards to the goal of reducing disparities, I think it's pretty straightforward how important these recommendations are. I myself am about to graduate from my master's program, and again found myself in the situation of trying to find mental health prevention resources outside of the college setting that are both affordable and accessible. And it's been extremely difficult to find those. So I just want to highlight how important the decisions that you as a commission make and how that affects people. And again, I just urge the commission to do their part in reducing mental health disparities by voting today to approve these two recommendations. Thank you.
Thank you.
Next, we have Stacy.
Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I know you've heard me a million times on this subject. I do want to thank the commission for considering to vote on this matter. This report is important, and we appreciate the work that the commission has done on the report. But when the legislation was passed, these priorities actually did harm. Again, yes, they're just recommendations, but when the counties go to do the PEI, they really need to look at what the priorities that the commission sent down are. And it has college age, transition age youth in college programs. So again, we had to fix this. And as other people have told you, the broad language of just saying culturally competent and linguistically competent programs or appropriate programs is really meaningless. So that is why the addition of the language of CDEPs will do something. I really also want to take a moment to thank the dozens and dozens of people who are not professional advocates, who have come to the meetings, who come today, who are taking time and they're texting going, how long is this going to take? They're not professional advocates, but they care about these issues. So thank you to them. And I also want to do one last thank you to our community partners. This issue has actually, in my opinion, brought the community together. CBHDA, the County Behavioral Health Directors, supports this. The providers support this. The client and consumer communities support this. This issue has actually brought communities of color, the LGBTQ community, they have come out in force on this. So I feel that this issue has really brought the community together. And I want to thank everyone for their support. And again, thank you, the commission, and particularly Commissioner Alvarez, for giving you the opportunity to consider this vote. Thank you.
Thank you.
And then our last in-room comment is Laurel.
Well, good morning again, and thank you. Beginning to feel optimistic, and so I won't be long, but I do hope you decide today. I'm glad that it looks like that's the way it's going to go, and that many of you support what we've been working for since 2018. I just want to say a word about the thousands of refugees from the Ukraine that have come to California, and especially to this area. It's a year now since their second trauma. The first trauma they had was when Stalin sent soldiers into their homes to take food out and people starved. And that was maybe why they are still fighting. And the college counselor at a local high school who, when I went to visit the career center, said to me, well, the students from the former Soviet Union, they mostly go into the allied medical professions. Those are not college degrees. Those are non-college. But they still have that intergenerational trauma before, and now they have new trauma. And then the Afghani refugees that came, 10,000 in the last year, just to Sacramento, not to mention the rest of California. We know about their trauma. It's been for decades on our news. Many of those youth just can't go to college, even if they may eventually. When they arrive here, they're traumatized, they're early candidates for treatment for PTSD. They're at risk for that, and it's treated best early rather than waiting. So there's urgency that they, if they're of college age, but not in college, have as many resources as possible. They just can't wait. So thank you again, and I'm hoping for the best. Thank you.
Thank you.
Sorry, we actually had one more in person. We have Sonia.
I refuse to be left out. I'm only kidding. Thank you so much. I appreciate it. My name is Sonia Young Adam, and I'm the CEO of the California Black Women's Health Project. We are very fortunate to have a project, a CDEP, that is a part of the California Reducing Disparities Project. It's called Sisters Mentally Mobilized. And I have spent the last 8 years leading this organization in support of better health and wellness for Black women and girls. And we take a mental health and all approach to everything that we do. This morning, on my flight here from Los Angeles,
I just began thinking and sort of wrestling about, I knew that there'd be lots of my colleagues and, the great advocates that I know, in the state who would come, with the comments about, the specific language. And I was thinking about that and, of course, with the work that I do at California Black Women's Health Project. And I thought, well, today, it might be very important, as we talk about populations and groups, and I know this is for all Californians. I mean, we do say that, we say all Americans, we do say that, but, I hold truths to be self-evident that Black communities are left behind, have been left behind. We think about the report and the language that's in the report and the 4 recommendations. And anytime I see things like that and I don't see structural and systemic racism, I see historical trauma, but it always seems like it's related to something else. But I see all of the pathology in our communities, homeless, incarceration. I saw some of those things, not particularly in the report, but in the slides that were presented. And it takes me back to, we include these situations or experiences in life, but we tend to neglect to define and to say out loud who is most despairingly, involved in those things. And in many of them, it's Black women, and in many of them, it's Black men. So when I think about, language in the, talking about transition age youth and those in college programs, I think about Black men. I mean, Black women, we tend to have, when you look at the Black population, better college experiences, college enrollment experiences. So I thought about Black men while I was on the plane this morning. And I just looked it up briefly. I mean, I know, from just my own knowledge, my own experience, my own family, the communities, where I've lived and, where I've worked in years prior. But I said, let me just be more specific and maybe just say to you, this. Overall, Black male college enrollment rates have been declining for the past decade. COVID-19 only exacerbated the decline. Why? College enrollment for Black men, it dropped 14% in the spring of 2021. And you say, well, why aren't Black men going to college? And I love this particular article because it talks about the 4 primary reasons. One is that they have less access to financial resources to go to college. Black youth are more likely to be suspended from secondary school. We always talk about the school system and where we need to do care. And I go, that's the place that harms us. And we talk about our, judicial system where, we have care
Your
court.
time's up.
Those are the things that harm us. And I'll just do the last one. The other reason, students lack access to role models. Black men have less role models in college spaces. Our community is not necessarily there in that place. So I do appreciate that there will be some language. I'm looking forward to seeing exactly what it is. I know it won't say exactly what I wanted to say, but I do appreciate, especially Commissioner Alvarez, for being so strong and steadfast on asking this commission to do something different. And I appreciate all of you who have stepped in and stepped up and said, we do need to move this forward. So thank you so much.
Thank you.
Okay, that was our last in-person comment. Now online, we have Jim Gilmer. Your line is open.
Good afternoon. This is Jim Gilmer. Can you hear me okay?
Yes, we can.
We can.
Okay, to all the commissioners, to my colleagues in the room, to clients and family members, just like to thank you for this day. And as a former member of the CLCC, I want to take my heart and my hat off to Chair Alvarez. You made my day today by your strong recommendation. All the trench work we did on the CLCC for this initiative, and to the fellow commissioners that I've heard today. It's been a long journey, heads bumped here and there, Toby as well, his staff and others, but I think we have come to this intersection of congruency that has made my day. And I've had my frustrating times, but it's, iron sharpens iron. We're at this place where we're going to have a very sharp threshing instrument to make change, throughout the state of California by adopting the 2 recommendations, which we all know. I don't have to repeat those and waste time. There are a lot of youth not in college, and obviously the valuable importance of CDEPs. We don't all drive the same kind of cars for various reasons. We all like different accessories, and that's how people's lives are. That's how the differentiation, a car is a car, but yet there's different types of models and dealers and all that, comparatively to how we serve our communities. And what's really interesting is that not only did the CLCC, but the Client and Family Leadership Committee also adopted the same recommendations to be inclusive. So it's like we're all heading down the same river now. We have different streams throughout California, kind of going all different directions, but now we're coming back to one river. And I'm gonna leave that metaphor in your mind that we're a powerful river now that can go out and create change throughout California. I want to say thank you all. And I urge the commissioners, take action today. Let's close this deal. Let's move forward and lock arms and work together. God bless you all. Thank you.
Thank you.
Next, we have Emily. Your line's open.
Thank you so much for providing this space. It is a privilege to be here. Without having, support from my family, I wouldn't be able to be here as an advocate in all these years as an advocate. I am here on my own time. No one is giving me money to be here, but I'm here because I care. So thank you, Stacy, for your comment earlier. I appreciate all of you for being here because it means that you have passion for people, your communities, and I am there with you because there are so many people who struggle in silence and they don't have the courage to ask for help. Even migrant workers, victims of human trafficking, sexual assault, generational trauma, because they've been silenced, because if they should say anything, the people above them who have power dynamics over them say, I'm going to do something to you if you speak out, right? So thank you so much for your leadership here, because it means that you care. Each one of you have your own personal stories that led you here today to serve on this commission, to be here and speak out for your own communities. Stories are powerful to help bring hope, because when there's just so much despair in this world, we have to hold on to hope. Martin Luther King Jr. said, we must accept finite disappointment, but never lose infinite hope. As a suicide attempt survivor, I have been sharing my story since 2010 and have done over 140 speaking engagements. I've been sharing my story for 10 years and the stigma still exists even today, to the point that I've been ostracized and marginalized in certain communities because they're not willing to hear my story. But I do this for my little brothers and sisters and everyone who struggles in silence, because I feel like I am their voice. And I'm not doing this to elevate myself, because this is called breaking tradition. And to the point that my own parents said to me, are you really my daughter? Do I have to disown you? Because they feel like I have shamed them. But my husband, when I was crying my eyes out, he said to my parents, she is not trying to publicly shame you. She's trying to say that she is one of many children of immigrant families who struggled in silence and had no healthy coping skills to be able to help her help herself. And her community had no skills either. And so, the stigma still exists today. And I feel like even though we talk about having, materials and other languages, we we really need to set aside some funding if we have a lack of social workers. If we don't have a lack of people who are passionate to go into the mental health field to become licensed clinical social workers, MFTs, therapists, psychiatrists, if we are in lack of these people, then we need to set aside funding to encourage these individuals to want to work in the field to serve the BIPOC community so that we can serve these underserved communities. And I've been looking for that for a long time, but I don't see it. And, you know, and then the systems also need to provide the support system so that these individuals, when they start working in the system, that they do not burn out. And so, you know, I believe that the system has so much, I agree, the system has so much to improve on. And as I always say in my talks, there is Nelson Mandela. He said, I never lose. I either win or I learn. So there is so much hope to have and in transforming our emotional pain into life lessons. Thank you.
Thank you, Emily.
Next we have Adrian. Your line's open.
Good afternoon. Adrienne Shilton with the California Alliance of Child and Family Services, and calling in today to thank the Commission and in particular the Prevention and Early Intervention Subcommittee's work to establish a strategic statewide approach to prevention and early intervention. And we thank you for the specific actions that are outlined in the implementation plan. We're really want to applaud the subcommittee for integrating the feedback that we have been providing, specifically with regard to the inclusion of community-defined practices in the PEI priorities. Specifically, the inclusion of the Opportunity Spotlight, community-defined evidence practices in the Well and Thriving report, and strongly support recommendation 4C. And we also would recommend that there be an explicit action item in the PEI implementation plan about the provision and scaling up of community-defined evidence practices. This really could ensure that this recommendation in particular come to fruition. And we further support that this report must prioritize outreach and engagement with all transition age youth under the identified priorities in SB 1004. We recommend that the Commission vote to approve that language today. And just in closing, this PEI report really presents an opportunity to identify where the Commission can and should be leading to drive additional state and local investments to true upstream prevention and early intervention where it can be most impactful. And the California Alliance is really eager to be partners in this effort. Thank you.
Thank you, Adrienne.
Next we have Cheryl. Your line is open.
Thank you. Good afternoon. I'm Dr. Cheryl Grills, Professor of Psychology and Director of the Psychology Applied Research Center at Loyola Marymount University. I'm a national past president of the Association of Black Psychologists and a founding member of the Alliance of Ethnic Psychological Associations for Racial Equity that includes the Asian American, Black, Latinx, Indigenous Psychological Associations, and the APA. I also currently serve as the PI, the Principal Investigator, for the California Reducing Disparities Initiative. I want to urge the Commission to pass a motion today to vote on non-college youth and CDEPs in your portfolio. To the extent that mental health disparities are a priority for the state, and to the extent that many more young people do not attend college than do attend, I believe the Commission appreciates the need for action now. In 2017, the American Psychological Association proposed several recommendations to address mental health disparities that included increasing the availability of mental and behavioral health services for diverse racial and ethnic groups. This is what is being asked of this Commission today, to put meat on the bones of cultural and linguistic competent mental health services through supporting CDEPs. Listen to the community. They have been consistent in their commitment to reducing mental health disparities through CDEPs. Today, you have the opportunity to demonstrate that you hear, you care, and you have the will to act. So I urge the commission, first, include transition age youth who are not enrolled in college to existing priority number 3. The mental health needs of transition age youth are not being adequately addressed. The data we compiled in the LA County Blue Ribbon Commission on Child Protection, along with extant published literature, revealed that far more TAY youth are homeless, incarcerated, unemployed, and not enrolled in college. Second, I urge the commission to add CDEPs to the existing PEI priority number 4. If you have a burning building and some are hurt, but they're outside of that burning building, but others are still in the building, what would you do? This is the scenario of mental health disparities. Why prioritize CDEPs? Because they cut across all of the other priority concerns that the chair has mentioned. You will find members of communities that are unserved, underserved, and inappropriately served in all of those other priority areas. Population-specific strategies are necessary when you have gross mental health disparities. And when we look at CDEPs, they reflect the culture, context, social determinants of health, and historical realities of California's diverse communities. CDEPs can improve the mental health of community participants who generally would not have formal contact with mental health services. While today I'm not yet free to share the findings from the California Reducing Disparities final report, I can say without hesitation that there is evidence of CDEP effectiveness based on findings from a 3-year positive youth development initiative in LA County conducted by myself and my research team. That involved 49 community-based CDEPs, and we can expect positive similar findings from the CRDP initiatives. So I call on you to do what you have the power to do and to align with the needs of diverse communities in California. Thank you.
Thank you.
Next, we have Angela. Your line is open.
There we go. Oh, sorry, hold on, I'm having audio issues.
Oh, let me try to unmute you again. We were able to hear you. 1 second.
Great, thank you, everyone. Hi, commissioners. Thank you so much. Angela Vasquez, Policy Director over Mental Health at the Children's Partnership. I'm calling in today to thank the commission generally and the subcommittee in particular for uplifting the extensive, acute, and longstanding mental health need for California's children and youth. We applaud the subcommittee for integrating feedback from the community regarding the inclusion of CDEPs and all transition age youth in PEI priorities and program planning. We also applaud the subcommittee for including specific calls for joint leadership across the many systems that exist to support children and their families in their mental health and well-being. I wanted to especially uplift the references in the report to prevention and early intervention services and strategies. We know that early adversity, trauma, and chronic stress contribute to difficulties later in life, including mental health difficulties. It is imperative that the commission use the opportunities presented by SB 1004 to review and revise the PEI regulations with respect to data, including fiscal data, collected and reported by counties as a key leverage point to secure and more strategically direct existing resources, focus future technical assistance efforts, and demonstrate a component of the administrative leadership called for in the report. PEI dollars are currently being deployed to demonstrate innovative collaboration between schools, early care centers, and local mental health systems. It is critical that the efforts to assess prior programs funded by PEI dollars do a deep dive into the experiences of families of young children and students in the K-12 system for lessons learned and understanding of ongoing barriers to ensuring the mental health and well-being of every child, particularly children from marginalized communities who face longstanding systemic barriers to care and healing, and really should be at the center of the state's prevention and early intervention efforts. We see this effort around PEI regulations as an essential component to making the collaboration and innovation referenced in the report come alive, and critical to the Commission's mission to ensuring access to effective and culturally competent care for all who need it, including children and youth. Thank you.
Thank you, Angela.
Next, we have Elisa. Your line's open.
Thank you. Good afternoon, commissioners. My name is Elisa Feld. I use she, her pronouns. I'm with the County Behavioral Health Directors Association representing county behavioral health departments. Just want to echo the thanks to, in particular to the PEI subcommittee who has held the space for all of these conversations and discussion, for hearing the feedback provided to date. And just to kind of start off with building off of what Angela just discussed regarding some of the call outs in the report itself. CBHDA, we are in strong support of the overall call to action to ensure a coordinated approach to prevention and early intervention services across all healthcare sectors and systems providing care. I know this was, we had great discussion during the workplace mental health report about how we can ensure that individuals who are receiving care and our commercial plans, you know, receive that care when needed, early quality care, so that way they are not forced to turn to the public safety net. With that said, CBHDA does want to call out that a lot of these recommendations, because they go across many different regulatory agencies that, you know, and different sectors, that this, while these goals are applauded, we are concerned that the PEI dollars that counties receive that are driven at the local level would not be enough to address all of these challenges. And so just want to bear that in mind as we look to see how we can move different aspects of this report forward, keeping in mind what PEI dollars are intended for, how they are supposed to be driven at the local level, and really to bolster the public net. With that said, I just want to also echo our support for the addition of the two priorities, transitional aged youth, all transitional aged youth, and community defined evidence practices. While a lot of folks have noted this, counties do have the flexibility to choose these priorities now. Oftentimes, depending on local politics, it is really helpful and key to have this, have the OAC's leadership and have this guidance in hand for local advocates and for county behavioral health departments to show that this is a priority of the state. Sometimes that explicit permission is needed, in particular for community defined evidence practices, which are not able to be funded through Medi-Cal dollars currently. So with that said, we want to thank you again for all of the hard work put into this PEI report, the listening sessions, and the space for having this conversation. And thank you.
Thank you, Lisa. I am going to ask, we have about 12 more public comments. I'm going to ask if we can please limit them to 2 minutes now. I understand that most of those commenting are in favor, and we greatly appreciate that. And we do want to hear comments. I would just ask if we could please go to 2 minutes because we want to get to the vote, and we are at 12:54. And we had planned to end around 1. So let's transition to 2 minutes so we can get to the vote. And so I'd ask for that. So I see, I don't want to mispronounce, Iba, if that's correct. I see you up next. And Amariani, I didn't mean to take over your role. So that's where I'm at. Go ahead, Amariani.
Okay, thank you. My name is Aba Laye, and I am the Executive Director of Whole Systems Learning, and we are one of the CDEPs that's part of the CRDP. And I want to echo what Josefina and Sonia and Stacy and so many others have said, so I'm not going to really spend time. I am definitely in support of the 2 recommendations today. So I would like to also echo what Elisa just said and focus my comments on that. And that is that the importance of the CDEPs is in assisting counties in prioritizing mental health disparities. So I'm in LA County, and LA County puts hundreds of millions of dollars in extra reserves instead of spending them on PEI, and has never issued a solicitation that addresses mental health disparities in any kind of way. So these recommendations are really going to be meaningful in our county. And I just want to comment on what Commissioner Madrigal-Weiss said in terms of there needing to be meaningful change in the systems themselves. And that's something that if the commission is able to do the kind of oversight that's needed, there's going to be systems change. And without that kind of oversight, there's not going to be systems change. And then finally, I just want to make a comment on recommendation number 4 about the behavioral health screening process. If ACEs is not changed, there's not going to be any behavioral screening process for the people that I serve. And the people that I serve are African-American males with trauma who are probation, parole, foster, and former foster. Their behavior is never assessed for trauma. It is always the matter of some behavioral disorder that then becomes criminalized. And the idea of a behavioral disorder is that there's nothing you can do about it. Trauma is something that you can heal. So unless ACEs is changed to include environmental trauma, it is never going to affect the people that need it the most. And those are the ones that suffer the mental health disparities. So I just, in the spirit of what Commissioner Madrigal-Weiss was saying, I think that we should take a look at the recommendations and the implementation plan with an eye on equity and mental health disparities, or again, as so many people have said, it's just going to be words. Thank you.
Thank you, Ava.
Next, we have Lillian. Your line's open.
Yes, I'm trying to see if I can come off camera. Here we go. Hi. Again, in the spirit of getting to the vote today, I will make my comments very brief. I echo everything that everyone has said. The only thing I would emphasize is just how important it is for the state level representation, the leadership, to communicate to the counties how important this is. The interpretation at the local level means a great deal. I mean, PEI is really the only route of access for many community-based organizations, and have been shut out in many cases, you know, from any opportunity to provide services with county funding. So this is really very, very important. And by the way, I'm with On Track Program Resources, and I'm a colleague with the California Reducing Disparities Project. But at the local level, On Track has a CDEP. And so when it comes to the challenges at the county level, familiar, and we're in one of the better counties that have been really trying to work within the spirit of what this report and what this advocacy is representing. And I just want to give a shout out to everyone who's been a part of this conversation. The commissioners, thank you so much. I mean, I really get that you get it, and whatever this is around the technicalities of the vote and all of that, I'm sure it'll all get straightened up. But thank you so much for your support, and thank you so much for my colleagues inside of the CRDP, others. Just the sustained effort on this has been really inspiring. So thank you all. I think we're all on the same page. And with that, I'll end.
Thank you, Lillian.
Next we have Diego. Your line's open.
Good afternoon, commissioners. My name is Diego Bravo. I'm a Los Angeles resident and also with Safe Passages. I wanted to come on today just to urge the commission to adopt these 2 recommendations discussed today, and to not only vote on this item, but to also vote on it today. I also just really wanted to stress the point that the majority of those testified at every single public OAC commission and subcommittee meeting this year and in previous years were folks who spoke about the 2 recommendations that we're discussing today. There are over 35 of us representing diverse communities throughout California, from Butte County all the way to San Diego, asking for these same recommendations, both virtually and in person. So I'm just very grateful that the commission just sees this dedication to the work and agrees on the importance of these priority changes by voting today, hopefully on these 2 recommendations set forth. Also, on a personal note, for the past decade, my own sister has experienced great difficulty with her mental health and in finding and receiving accessible, culturally responsive care. She is transgender and 2 weeks ago had to receive immediate in-hospital care for a mental health crisis she experienced in SF. Thankfully, she is safe and at home now with family. But since then, I've just turned over every stone to find her local mental health resources for transgender adults that are culturally responsive to her life and experiences. Because in my understanding and relationship with her, I believe this is the only way that she'll find true success in healing. And this has been super difficult, but programs and interventions like CDEPs have been just proven to work for LGBTQ plus identifying individuals like my sister. The evidence is there across the board that culturally responsive care is extremely effective at decreasing mental health disparities in underserved and marginalized communities. And we just really appreciate your understanding and collaboration around this. So that's all. I know we're trying to make it to the vote. But again, we thank you all so much for your time and energy. And I look forward to the rest of the meeting.
Great, thank you, Diego. I'm sorry to hear about your sister. I'm glad that they were able to get support there. I'm going to have to pause. I'm sorry, community comment, because we are pressed for time right now and we are going to lose commissioners and we don't want to lose the vote. So we're going to move forward at this time. We know how important this is and we don't want to lose the vote. So I apologize on public comment. We can look to, I will stay for public comment afterwards, but let's get to the vote. So with that, I am going to move on the first motion. Jeff, help me out. The first is to—
Commissioner, I
Yes.
apologize. I will help you out, but I must give you some information. And that is I do not believe we have a quorum at this time. So I don't believe scurrying to a vote will actually accomplish your goals at this time. We have reduced number of commissioners such that we do not have a quorum and therefore cannot take a vote. So maybe you want to continue to receive public comment at this time, but we do not have enough commissioners to take a vote.
Can I jump in and just say that you will lose me in 10 minutes because my daughter has an IEP. And as much as I want to and believe this is important, I apologize. I do have to jump off.
Keandra, Commissioner Bunch, I knew that's why, but I didn't realize that we lost another at 1:03. Just saying.
Yeah, we have exceeded the time on the agenda and we are down to no more than 8 commissioners and we need 9 for a quorum.
Okay. Okay, so then
are we expecting someone to come back on? Or we're not going to have a quorum regardless?
Staff is not aware of an additional commissioner that plans to return at this time.
okay, yeah. So let us continue forward with the vote. We will still keep it to 2 minutes. So Jeff, please, what would we do then moving to next month? We will just keep this 2 votes as stands and then take a, God, I don't, please tell me.
Yes, Commissioner, we would need to take a vote at a time when we have at least 9 commissioners. And so that could be at the next, presumably the next meeting. And we would agendize an item for voting purposes. And we would hope that it would take far less time for any comments because those have been received today.
So Chair, I'll stay on and see if someone returns for us to have a vote.
They're trying to reach out, Commissioner Bunch. So I'm sorry. So let's okay. So so if we can move, if we could go to, let's go to 1 minute to see if we can get another commissioner on. So Vera, we're gonna go ahead and go with you. And I apologize if we could do it in 1 minute and please, Vera. Don't mean to rush you. We're trying to do the best we can so we could get a vote going today. So bear with us as we do the best we can to reach our commissioner. So Vera, if you want to go ahead, please. Oh, somebody, if we could let her off mute.
There you go, you should.
Hi there. Thank you so much for giving me the opportunity to speak. I don't know that this is going to take 1 minute, but I have something important to say. I've never shared my story publicly. I've been serving on the California Behavioral Health Planning Council since 2016. And I'm currently chair of the Workforce and Employment Committee. I was just elected chair of the steering committee for the newly formed California Association of Peer Professionals, the first association of professionals. So, but this story for me is very personal, deeply personal, and it goes to college-age students and culture. I'm a Black Japanese girl, old girl. My father was born in 1911 in East Texas. Sharecropping family. And he met my mother in the Air Force when he was in Japan. He lived there for 12 years. They moved after my brother and sister were born in Japan. They moved to San Francisco. My dad ended up getting a job working for the Air Force and NASA. He was the only African-American in 1962 working in space operations. So I grew up in Santa Barbara County, and my dad was a high achiever, very strong-minded, very strong-willed, and he always pushed us to achieve highest limits and to excel in everything that we did academically. Even to the, I mean, we were able to do sports, but even that, if that got in the way of straight A's, then the sports had to go. When I was at Stanford, I was so excited to be there. All of these people, all of these wonderful courses. I'd never gone against my father.
Oh, Vera.
He encouraged me to be an engineer. I didn't know what an engineer was, but I majored in engineering. All my professors encouraged me to write. They said, you have a gift, you gotta write. And when I was a freshman, one semester, I was with my two roommates, my white roommates, the wonderful women. We were looking at courses, and they're talking about courses they wanted to take. And I said, don't you have to ask your dad what classes you can take? And they laughed at me. And that was the first time I thought, maybe there's something wrong with my family.
Vera, we're going to have to move on to the next speaker. I'm sorry. Did you want to make a comment on the?
I would like to make a comment that you cannot ignore college-age youth, and you cannot overlook the fact that culture plays a strong role in behavioral health and people growing up. When my dad refused to allow me to major in writing, that was the first time that I said, the only way I'm gonna be able to get away from that pressure, loving my dad and loving my parents, but I knew the only way I would be free would be if I killed myself. And that was my mission for the next year. And I heard recently that Stanford still encourages its undergrads to stay out of school when they're experiencing mental health issues. So please don't assume that we're in a brave new world, because a lot of cultural institutions are still in place. So people need support. Please
They
don't.
absolutely do. They absolutely do. Thank you, Vera. From one Air Force Air Force daughter to another. Thank you for sharing your comments. Appreciate that. All right, we will move on to Michelle, please. And if we could keep it to 1 minute, it is 1:11. We are trying to get to a vote. We will try for a few more minutes. I'm sorry for those of you hanging on with us. Doing the best we can here for you.
Thank you. Good afternoon. I just want to start very quickly with, this is very disappointing that the commissioners left. While I understand the commissioners have a life, please do understand, we all do. We all have something that we're postponing to stay to make public comment or to participate. I would like to thank the commission for the opportunity to speak, and I'm going to go as quickly as possible. My name is Michelle Foswap, pronoun she, her, hers. And I work with County Charities as a senior manager in the Crisis Response and Family Preservation. And I'm also a very proud member of the African American Hub of the California Reducing Disparities Project. It fills me with great pride, joy to see how we show up in positive force as a cohort of folks every time there is a commission meeting. I obviously am in favor of the commission passing a motion today to approve the 2 recommendations. Despite our obvious privilege, we're members of the same community and educational systems as the clients we support. And in all platforms possible, we raise our voices in support of sustainable funding for our community-based projects to be recognized as we are the experts in providing this support for BIPOC and LGBTQ+ communities.
You, Michelle, your time is up.
Okay. All right. Well, I will go with that. And thank you for your time and listening.
Thank you, Michelle.
Okay, next we have Heliana. I'm sorry if I did not say that right.
No problem. My name is Dr. Eliana Ramirez. I use she, her pronouns. I am a social worker. I'm a licensed clinician. I'm also a researcher. I specialize in racial and LGBTQ trauma research. I'd like to begin by thanking Commissioner Alvarez for her courage in speaking directly on this issue. I am in support of the recommendations by REMCO and members of the CRDP. In particular, I just want to speak about the trauma focus of the report. Thank you for that focus of the report. With COVID-19 disproportionately impacting communities of color, with mass shootings targeting communities of color, with police-involved violence and murders affecting communities of color, I think about my training as a trauma researcher in cognitive processing therapy, prolonged exposure therapy, cognitive behavioral therapy for people with substance use disorders. The predominant evidence-based practices for trauma, none of them account for racial trauma. None of them account for LGBTQ-related trauma. So the flip side of the coin that we're talking about here with the importance of community-defined practices is that that's where we can have the healing for the racial trauma and LGBTQ trauma. Thank you so much to all of you for making this a priority, and I'm honored to be here with all of the community, Vera and others who have spoken here today. Thank you.
Thank you.
Next we have Jason, your line is open.
Hi, everybody. Thank you. My name is Jason Robinson. My pronouns are he, him, and I'm a member of the Client and Family Leadership Committee. I'm a person with lived experience. I'm a family member, and I'm also on the board of directors for CAMPRO. And I think this process has shown the value and the practices inherent in the law, the stakeholder process, people bringing their needs to the commission, to these bodies. And I want to urge the commission to vote yes on the recommendations, the 2 recommendations for TAY college-aged youth, including those not in school, and the community-defined practices as recommended by the Client and Family Leadership Council. And I really support and acknowledge everybody's testimony today. Thank you.
Thank you, Jason.
Next we have Kendra, your line is open.
Yeah, thank you. My name is Kendra Edwards, they and she pronouns. I'm a Black queer social worker in Oakland, and I also work on CRDP CDEP. Wanted to say quickly that with any new policy, it's our responsibility to review it and identify potential gaps who may be disproportionately impacted. As folks have already said, in this current wording, we know that these strategies unintentionally leave out folks and leave potential for us to lose funding. So we're asking for just 2 very small shifts. In fact, the majority of us are left out of the current wording. 60 to 70% of Black and Brown youth do not enroll in college and are thus left out. So the majority are currently excluded. And that second piece is just to include the language of the CDEPs and just naming it, leaving room to exclude proven culturally relevant solutions reduces the impact of this funding for our communities. We know that. I also wanted to highlight that one of the action steps for the commission specifically names working with the CRDP as experts in addressing disparities. So you have an opportunity today to show us what this relationship really works, if it really works and what it looks like by putting this to a vote. And yeah, I hope that we can do that. Thank you.
Thank you, Kendra.
And then next we have Paul, your line is open.
Yep. Okay. Hi. Can everybody hear me?
Yeah, we can.
Okay. Here we go. 1 minute speed dating. Dr. Paul Masadi. I'm the Director of Research at the Native American Health Center, which is FQHC. I just like to briefly touch on CDEP effective research and use that to slide into CDEP policy advocacy. And I know some of you have heard this. Recent research, I'm surprised Dr. Grills didn't mention this, and she presented in a conference, but they recently did a statewide cost benefit analysis among all the 31 CDEP grantees and basically looked at incremental increases in the mental health measure, and they concluded that for every $1 spent, there was a good cost effectiveness cost benefit ratio and $1 savings. And I don't know why she didn't present that, so I won't present anymore. More recently, as a result of CRDP, which is all about CDEP research and evaluation, we developed and validated an instrument that quantifies Native American culture on 3 subscales. And in our large sample studies, we're up to 700 right now, we basically demonstrated that just increase in culture, and all the CDEPs for Native Americans are entrenched in culture, those are associated with better mental health, better physical health, increased satisfaction with life, decreased risk for depression, and decreased substance use disorder. Okay, now sliding into policy advocacy. What are the differences between evidence-based practice?
Time is up. Thank you.
Okay, well then, we'll stop there. Thanks.
Thank you.
And then last we have Juan.
Please, Juan.
Hi, everyone. Thank you, Commissioner, for letting me speak. I'll keep it short. I just wanted to voice my support for the 2 recommendations, supporting youth who are not in college and calling out the growing and changing population of BIPOC LGBT community. I'm Juan Torres, Executive Director of Humanidad Therapy in Sonoma County, where about a third, 30% of our population is Latinx, and we have historically been ignored. And I think this needs to be addressed. And my ask specifically is that we vote today. I'm hopeful that it will happen. So I'll keep it short and end it here. Thank you for your time.
Juan, thank you. And thank you for everybody who provided community input. We are not going to be able to vote today, is my understanding. Is that correct, Jeff?
Yes, I believe your understanding is correct. We do not have.
Okay, and so what we will do is we will agendize the vote for next month's commission meeting, where we will have an overview of the report and the priorities that were set for a vote, the 2 new priorities that were set for to be voted on today, that were created today for next month. Yes, that's correct, Jeff?
Yes, that would be correct.
Because we need a quorum to be able to vote. So for the commissioners that will be at next month's meeting, we will provide an overview of both so that we're able to vote then. I'm sorry, Commissioner Rowland, did you raise your hand for a question?
Yeah, but you answered my question. Thank you.
Okay, perfect. So thank you, everybody, for your conversations. I want to thank all my commissioners that were here for the conversation. I'm so happy that we were able to work this out together. You know, together we're better. I completely believe that and know it. I want to make sure that this isn't where this discussion around priorities and as a commission, right? We want to also move forward the implementation plan that goes along with this report. So this is just, you know, the beginning of more. So I'm sorry, it's 1:21 and you know, we always guesstimate when we're going to end. So I know that we're all here and we're all given our time. And so I'm sorry that we weren't able to establish the quorum for this vote. So we will see you next month, either virtually or in person in San Diego, where we plan to hold our next meeting. Have a wonderful day. It's a win for all. We were able to establish at least a vote. We'll see where that goes next month. So congratulations to everyone. Thank you for being here today. And we will see you next month. Take care of yourselves. Be careful. The weather's going to be really, you know, offset this in the next 4 days. So take care, everyone. Wish you a great day.
Thank
Bye-bye.
you, Chair. You too.
Thank you.
You.